Good morning, everyone, and welcome to this edition of the Interim Committee on Commerce and Labor. This will be our final meeting. For those who have been following us all along, it seems like it's come up all of a sudden, but we've had some fun. So we'll do our roll call first. Madam Secretary, please call the roll.
Senator Lang.
Here.
Senator Stone.
Here.
Assemblyman Carter.
Present.
Assemblywoman Kasama. Assemblywoman Marzola.
Present.
Assemblyman O'Neill.
Here.
Assemblywoman Torres. Chair Spearman.
Here, and please mark Assemblywoman Torres present once she arrives. She's running about 25 minutes behind. As most of you know, we have a couple of educators on our committees, and school has started again. So just one quick note, agenda item number 5, presentation on protecting workers in extreme weather conditions. That item has been pulled, and so it will not be a part of our meeting today. Before we begin, let's go a few housekeeping items. First, remind everybody, please silence all of your electronic devices, cell phones, Apples, iPads, anything that's going to make a noise to distract from the presentations. Individuals on Zoom, please be sure to mute your microphone when you're not speaking to minimize the noise in the background. But those of you who are members of the committee, please keep your video turned on during the meeting. In addition, for Zoom participants, the chat feature is only to be used for technical assistance with broadcast and production services. It is not to be used for any communications between members or by presenters unless requesting technical assistance from BPS. The committee meeting materials can be found on the Nevada Legislature's website. You can also sign up for electronic notifications related to any activity on the committee's website. If you wish to testify in person, please sign in at the table by the door and leave a business card. And even if you do not testify, you may also want to sign in so there is a record of who is interested in a particular topic, and in the event the committee needs to contact you later. When testifying in person, please turn the microphones on to speak and speak directly into the microphone. Please turn off the microphone when you're done speaking. Remember, we have listeners and viewers in Carson City and online, and if you do not speak into the microphone and speak clearly, they will not be able to hear you or to understand you. We're recording this meeting and it will be available on the legislature's website. We'll have public comment period at the beginning and at the end of the meeting, and public comment is limited to 2 minutes per speaker. In addition to testifying in person, members of the public may also provide public comment in 4 different ways, all of which are listed on this agenda. You can provide public comment by calling 888-4499, then entering meeting ID 856-9832-1592 and press pound. You can email comments to clinterim@lcb.state.nv.us. You can mail written comments to Research Division 401 South Carson Street, Carson City, Nevada 89701, and by faxing to 775-684-6400. You can find the phone and fax numbers, email addresses, and all of the above on the agenda. With that, we'll move on to public comment, and we'll start with public comment here in Las Vegas. If there's anyone here that would like to do public comment, we'd ask you to come forward now and fill all the chairs. And if there aren't enough chairs for you, if you'll sit close enough to the front that you can occupy one of the chairs once they are vacant, that would be appreciated. Anyone in Carson City wanting to make public comment, please come to the witness table at this time. So let's start in start in Las Vegas. Ready when you are.
Good morning, Madam Chair, members of the committee. Victoria Carrion for the record. I'm the administrator of the Division of Industrial Relations. We are here today just to provide a little information in relation to item 5, which I understand is withdrawn. Our agency has been working for the past 4 years on a regulation to address heat illness in the workplace, and we've just been working with a variety of stakeholders, advocates, business industry, unions, et cetera. We do have a workshop on our regulation tomorrow at 2 p.m. and the regulation for your references are 131-24. So just wanted to put that on the record. Thank you.
Good morning, Chair Spearman, members of the committee. For the record, Cadence Matievich with Washoe County. I'm here today to speak on item F on your work session document relating to homeowners insurance for wildfires. And to express our support for your urging of the governor and Department of Business and Industry to study the issue of a fair plan for homeowners and also the creation of a task force. We welcome the opportunity to participate in that. We understand that these are complex issues and may take some time to study, but I do want to express to the committee the urgency of this issue for Washoe County and particularly for our residents in the Tahoe Basin. At a recent town hall that the insurance commissioner held, we heard heartbreaking stories from senior citizens in that community who've lived in the basin for over 50 years. These were folks that were public servants, school teachers, and because of this issue, they are facing potentially having to sell their home and leave the basin. So as opportunities may come up during this upcoming session, we would encourage you to consider legislation to help address this issue, particularly the issue of parity for policies that cover properties that are considered commercial, but in fact are residential properties. The issue that you heard from the insurance commissioner last month about policies that cover homeowners associations, particularly that particular issue is really affecting workforce housing and seniors in our community in the Tahoe Basin. So we appreciate your consideration and look forward to remaining engaged with you on this issue throughout the session. Thank you.
Good morning, Madam Chair and members of the committee. For the record, my name is David Bihar, and I'm the Executive Officer for the Nevada State Contractors Board. I'm here today to offer comment regarding the board's statutory authority to investigate and prosecute unlicensed contractors as it relates to item C on your agenda. As I shared during a presentation to this committee in April of 2024, the mission of our board is to promote public confidence and trust regarding our licensees while protecting the health, safety, and welfare of the public. Our board advocates for a shorter 2-year statute of limitation for unlicensed contracting for several reasons. The first is to encourage consumers to use licensed contractors for the benefit of having a total of 4 years to have their complaints investigated. The second is to meet a requirement for potential financial recourse of up to $40,000 from our residential recovery fund. Our board believes increasing the statute of limitations for unlicensed activity would be detrimental because it would encourage individuals to continue hiring unlicensed contractors, which would place even greater pressure on local and state prosecutors who already face significant caseloads and struggle to prioritize matters involving unlicensed contracting practices. The current timeframe for prosecuting these matters criminally is 2 years, and that's why our board statute of limitations for this matter mirrors that. Our board has welcomed the support of administrations from both the governor's office and state attorney general to produce public service announcements targeting the dangers of hiring unlicensed contractors. We've also increased our public awareness on this important issue through a variety of workshops and partnerships with stakeholders that include the Legal Aid Center, County Commissioner's Office, Hispanic Contractors Association, and many others. We appreciate an opportunity to be available to you if necessary during today's discussion and are happy to address any additional comments or questions any other committee members may have. Thank you.
Good morning, Chair Spearman, members of the Interim Joint Committee on Commerce and Labor. For the record, Paul Muratkin, Senior Vice President of Government Affairs for the Vegas Chamber. First, Chamber appreciates the Chair for withdrawing item 5 from today's agenda. The reason being that a diverse and broad group of stakeholders who have convened during the interim period and working in collaboration on regulations that will be placed for consideration to the Legislative Commission in December for approval regarding heat safety standards. The focus of these proposed regulations is address heat illness and employee protections that will be administered in Nevada OSHA. The Chamber, along with numerous business associations and chambers, have made the pledge that we work with OSHA, labor, employees, medical professionals, and environmentalist groups to address the concerns that were brought forward about heat regulations during the 23 legislative session. Committee members, the Chamber and our trade association partners have kept our word by working to develop rigorous regulations that will be set forward for approval that are focused on employee safety throughout an assessment process and relating regulations that will be adopted by employers throughout the state. These proposed regulations have been developed in a manner that provide additional protection for workers, but will also allow employers to comply in a reasonable, practical manner. We have kept our promise to legislative leadership, to you as members of the legislative body, and to Nevada's workers that we would get this done. And we look forward to its adoption in December of this year. Thank you, Madam Chair and members of the committee.
Good morning, Chair Spearman and members of the committee. My name is Olivia Tanager. I'm the Executive Director of the Sierra Club's Toyabe chapter. The Toyabe chapter represents 40,000 members and supporters from across our great state, and as such are the largest environmental grassroots group in the state. The Sierra Club supports both actions proposed related to wildfires and homeowners insurance on today's agenda. Just the other day, I got an email from one of my board members who lives up on Mount Charleston, and after the state updated its fire map, now she has under a month to find new insurance because Allstate will not insure her home or any of her neighbors' homes due to the new fire map. She has complied with all requests from Allstate to lower the risks of fire to her home, and still they will not insure it. I grew up in Florida, a state with a similar insurance crisis due to anthropogenic climate change. In Florida, we used to call hurricanes by their names, and there would be a bad one every few years. But now my family talks about hurricanes in terms of years because there are several a year, and their names are becoming too difficult to remember. We appreciate the actions on today's agenda and hope that these steps are taken in conjunction with impacted communities across our state so that communities are consulted and can benefit from any changes to our policies as it relates to homeowner insurance. I hope we can have future conversations guaranteeing some form of homeowners insurance to all Nevadans while also putting up new construction in places that makes ecological sense given the increased likelihood of wildfires. We also appreciate several other items on the agenda, including legislation to help address our housing affordability crisis. We believe people on the planet are the healthiest when our neighbors can afford to live in dignity. Thank you for the work you do as caretakers and stewards of our great state. Madam Chairwoman, you will be missed in Carson City. Thank you.
Thank you. I want to go up to Carson City now, and then we'll come back down to Las Vegas. Carson City?
Good morning, Madam Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners for the record. Here today in support of Agenda Item 7, and really would urge the committee to consider legislation for the upcoming legislative session that continues the work of the last legislative session with Assembly Bill 434 in protecting the 340B program. In many of our rural communities across the state, we might only have one retail pharmacy, and if actions are taken that prohibit that retail pharmacy from serving as a contract pharmacy in a 340B program, then in many of those cases, the 340B program would cease to exist for those residents. With that said, really appreciate the consideration of this item today, and again, urge the committee to protect the 340B program in the state of Nevada. Thank you.
Thank you. We'll come back down to Las Vegas.
Good morning, Chair Spearman and members of the committee. Thank you for your time today. For the record, I'm Jacqueline Nguyen, Nguyen, and I'm the Policy Director for the Nevada State Medical Association. On behalf of the Nevada State Medical Association, the state's largest and oldest organization representing physicians and physician assistants, we're here to express our concerns regarding Agenda Item 9D regarding CRNAs, and specifically the recommendation proposed by representatives of the Nevada Association of Nurse Anesthetists, which requests legislation to amend NRS 632.2397 to delete provisions that prohibit a certified registered nurse anesthetist from ordering or prescribing a controlled substance, poison, dangerous drug, or device outside of a critical access hospital. The legislation in question was only enacted on January 1st of this year. The original Assembly Bill 198 and Senate Bill 336 of the 2023 legislative session were thoroughly debated. In Nevada, a CRNA may possess and administer controlled substances, poisons, dangerous drugs, and devices pursuant to a valid order from a practitioner. Pursuant to the new legislation, CRNAs working at a critical access hospital had a change in their scope of practice where now they may, under the supervision of a physician, order, prescribe, and possess controlled substances to treat a patient under the care of a physician. The argument for this change in legislation was to increase access in the rural areas of our state where physician access was more limited. The compromise legislation's aim was to address the rural challenges while also maintaining the highest quality of care for our patients. Now, only 8 months later, after the new legislation went into effect, the same groups are asking for removal of these restrictions, which were put in place to ensure patient care and safety. The Nevada State Medical Association has always maintained that while access to care is important, access to quality care is paramount, and patient safety should be the top of mind consideration for any legislation. We urge this committee to revisit the rationale presented last session that led to the compromise legislation and not relitigate this issue further in 2025 when we do not yet have any data of the ramifications of the original SB 336. We remain strong allies to this committee and are an advocate voice for our patients to maintain their safety and well-being. Therefore, the Nevada State Medical Association and our physicians are available to be a resource to you on all healthcare matters and matters of patient safety and care. Thank you.
Thank you, Chair Spearman and members of the committee. My name is Emily Osterberg. I'm here representing the Henderson Chamber of Commerce and our over 2,000 members. We were also concerned about item 5 and understand the item has been pulled. We have been a part of the working group made up of a wide variety of industries that work together with OSHA for the better part of a year to create a heat illness regulation. We do not believe further legislation is needed as the regulation addresses the issues of heat illness and takes into account priorities and concerns from both the business community and OSHA. Thank you very much.
Yes, Madam Chair, members of the committee, my name is Terry Graves, representing the Nevada Manufacturers Association. And not to be repetitive, I endorse the comments made by Mr. Muradkin. During this last legislative session, we gave quite a bit of testimony regarding the heat regulation under item 5. The only additional comment I'd make, after coming out of the pandemic, this country discovered that we have offshored a lot of very important manufacturing. And we do not want to impose regulations that inhibit repatriating and bringing some of these critical manufacturing operations back on shore. So that's my only comment for today, and I thank you for your time.
Good morning, Chair Spearman and members of the committee. Allison Genko, last name spelled Genco, Director of Nevada Government Relations for Dignity Health St. Rose Dominican, here today to support item number 7, which looks to ensure pharmacies can continue to contract or participate with an entity that is a 340B participant. Our San Martin campus was recently approved by the Health Resources and Service Administration to become a 340B provider. And as a newcomer in this space in Nevada, we want to ensure we have all the right tools to better serve our community. And we believe this proposal looks to achieve just that. We want to thank Renown Health for bringing this forward, and we look forward to seeing its passage. Thank you for your time.
Thank you, Madam Chair, committee members. Misty Grimmer with the Ferrara Group representing the Nevada Resort Association. Also, we are appreciative of the chair for withdrawing the item number 5. We have been very active in the negotiations and the conversations that have happened since the Ledge Commission directed us at the end of 23 to get together with OSHA and come up with a regulation that will work to cover the safety needs of employees and also be something that employers, that's functional for employers. And the agency has been amazing to work with. They have hosted multiple, and when I say multiple, I mean more than just 2, multiple meetings with all of the players so that we can work through all of the issues and all of the details that will be in the reg, which will come before you as the director already mentioned. Where the first workshop is tomorrow, and then the reg will probably most likely be adopted by December. It addresses all of the various issues such as mitigation for heat illness, training for employees, training for employers,
all of the various things. And so we are appreciative that the item was withdrawn and look forward to seeing this go into effect and giving it some time to work. Thank you.
Good morning, Madam Chair and members of the committee. Peter Saba, Senior Manager of Government Affairs for the Nevada Restaurant Association. I'm here on behalf of the association to express our opinion with the recent events about item 5. For 19 months, we have worked tirelessly in good faith, negotiating and compromising to reach a fair agreement that benefits all stakeholders. We are proud of the role that we have played shaping this legislation, and we are thankful for removing it off today's item. Thank you.
Thank you. I don't see anyone else in Carson City. BPS, let's go to the phones and just remind everyone who is calling in, please, please, please turn off whatever apparatus you've been listening to us on so that we don't get the feedback and we can get into your comments as soon as possible. So BPS, I believe we have some folks on the line.
Thank you, Chair. Yes, ma'am. If you'd like to participate in public comment, please press *9 on your phone now to take your place in the queue. Caller with the last 3 digits, 725. Please press *6 to unmute. Go ahead, please.
Hi there. This is Andrew McKay. I'm the Executive Director of the Nevada Franchise Auto Dealers Association. Wanted to briefly echo the comments made by my colleagues, Ms. Osterberg, Ms. Grimmer, Mr. Muradkin, as well as Mr. Graves, and thanking you, Madam Chair, for withdrawing agenda item number 5. As everybody represented, we spent the better part of well over a year working on this, and want to thank the division for their accommodations and frankly herding the cats, for lack of a better term. However, for point of order, there is still, with respect to the work session, there is, and that would be agenda item 9I, and I presume due to the withdrawal of agenda item 5, that would be withdrawn as well. However, I just wanted to make sure we put it on the record that that BDR, in our opinion, is simply not necessary due to the fact that we are addressing this in the regulatory process. So, Madam Chair, members of the committee, thank you for your time, and I really appreciate it.
Caller, you're unmuted. Please proceed.
Hi, this is Alexis Motorex with the Nevada Chapter Associated General Contractors, and I just want to echo the comments of the previous speakers and express our gratitude that item 5 was withdrawn. These protections belong in regulation, not statute, and we've been working toward that in earnest and are close to seeing it adopted. Thank you.
Good morning, Madam Chair, members of the committee. My name is Tom Clark. I'm calling in on behalf of the Reno Sparks Chamber of Commerce, and we'll just echo the previous comments from my colleagues at the other chambers and the other trades regarding item 5. I'm also calling in regards to item 9D, as we represent the Nevada Association of Nurse Anesthetists. When we brought this concept forward during a regular hearing, there was very little opposition, and we have worked with all of the other stakeholder groups on this particular item and would hope that it would move forward and become a bill draft request. Thank you, Madam Chair.
Caller,
Good
please
morning,
proceed.
Madam Chair. Okay, can you guys hear me now?
Yes, ma'am. Thank you.
Thank you, BPS. Good morning, Madam Chair, Vice Chair, and the member of the hardworking committee. My name is Dora Martinez, and I represent the Nevada Council of the Blind, as well as the Nevada Disability Peer Action Coalition. I'm calling on behalf of my group and to speak on the affordable and low-income housing. Please include into that accessible housing. There are people with disabilities and seniors and veterans who will be needing that accessible and affordable housing. And I hope that when you are all doing these things, you also considered transportation equity as well. So when they are building these apartments, there is a RTC transportation available nearby. So people with disability and seniors and veterans will not have a hard time catching their bus and do what they need to do. And one more thing, thank you, Assemblyman O'Neill, for helping me out with your constituent who happens to be blind, who lives in Carson. Her situation has been resolved. Appreciate everything that you all do. Take care and stay hydrated. Thank you, Madam Chair. We'll miss your voice. Bye-bye.
Chair, there are no additional callers for public comment at this time.
Thank you. I don't see anyone here in Las Vegas and don't see anyone up in Carson City. And so now we will move to, and by the way, a reminder, there'll be another public comment section at the end of the meeting. So for those who are listening and say, oops, I missed it, if you hang around till the end of the meeting, there'll be another one. Let's move on to agenda item 3, approval of the minutes for the meeting on July 31st, 2024. And just before we do that, Madam Secretary, please note that Assemblywoman Torres is now here. So, members of the committee, are there any questions regarding the minutes? Then I will accept a motion to approve the minutes of the committee meeting on 1st, 2024.
So moved.
I have a motion by the Vice Chair. Is there a second?
Second.
I have a second by Senator Lang. Any discussion? All in favor, aye. All opposed, nay. And the ayes have it. The motion carries. We'll move now to agenda item number 4, presentation on identifying and addressing health and behavioral health disparities among vulnerable populations. And Ms. Dortch, this may or may not be a part of your presentation, but if you would just make note of this, on Monday in another committee meeting, we had a number of persons who were here from the deaf and hard of hearing community that noted that one of the things that concerns them and quite frankly scares me is the fact that in many of the hospitals, they do not have access to interpreters when they show up to the emergency room. And in a situation where minutes matter and could be a matter of life and death, that certainly should be one of our priorities, trying to figure out how we fix that. So it may not be a part of your agenda, but I just wanted to put that on your radar. So with that, begin when you're ready.
Good morning, Madam Chair. Are you able to see the presentation?
Yes.
And can everyone hear me?
We can hear you.
Thank you so much. Good morning to the Interim Standing Committee on Commerce and Labor. Good morning to Chairman Spearman. I am Tina Dortch, and that's spelled Tinadortch, and I'm with the Nevada Office of Minority Health and Equity. I am its program manager, and today I will be sharing an educational presentation on effective data collection and equitable utilization as a way to identify and address health and behavioral health disparities among vulnerable populations. Control. Control L to advance. I needed to advance. Very sorry, Madam Chair. Needed to advance. We just click the mouse. Thank you very much. Perfect. First, members of the public, or perhaps members of this committee who may be wondering, what does effective data collection and equitable utilization as a way to identify and address health and behavioral health disparities among vulnerable populations have to do with commerce and labor? Well, it's my intent that by the end of today's presentation, you will have identified how the conditions in which we live, that we work, that we play and age, and even socialize plays into concerns that relate to the work of this committee. In order to do so, as indicated on the agenda, I will provide a brief overview of my office, the intersection of public health, health equity, Nevadan well-being across social determining categories, statutorily tied data collection examples that highlight focus on underserved communities, and I will briefly review future possibilities of data utilization collection. Here we are. The Nevada Office of Minority Health and Equity is also known as NOMI. It's located within the Department of Health and Human Services, and this office was established in 2005 as a result of Assembly Bill 580 in an effort to address health disparities among minority communities. In 2017, because of Assembly Bill 141, it was expanded through its scope, and its name was changed to include the reference of equity. This was done to de-emphasize that one-size-fits-all practices are even reliable. On broadening this definition of minority, we also serve to encompass the varying intersections of vulnerable populations beyond those defined merely by race and ethnicity. NRS Statute 232.475 lays out how NOMI achieves its fundamental mission, and in my 6 years plus managing the office, it's become a connection point across many of the socially determining categories of health for the department. The department's ability to develop public health initiatives and NOMI's ability to action its purpose is predicated in large part on our collective sustainability. Data supports this sustainability. Measurement allows for proportionate responses to need, and the resulting data validates action. As an office, NOMI works to educate, to serve, and to advocate for systemic change in alignment with our mission. We action our mission through efforts like those you see listed on the slide, and I will just point out a couple. We collectively develop strategies to achieve sustainable systems changing initiatives and providing equity-focused technical assistance to governmental agencies and community organizations. An example of this is NOMI's Health Equity Action Plan, or our HEAP. The HEAP aims to help government institutions, service providing agencies and organizations across the state to integrate health equity considerations into their work by providing a framework and examining the challenges and practices that perpetuate health inequities. The HEAP includes a glossary of terms, an overview of health equity, and identifies improvement areas. It also offers policy, program, and resource-related recommendations and guidance on how to turn these theories into action through the use of case studies. The development of the HEAP was made possible by grant funding and reflects a collaborative effort with contributions from state and local agencies, public and private health providers, academic institutions, our tribal and rural partners, community-based organizations, and nonprofit organizations. Activities like the HEAP are rooted in our strategic planning. So in order to fully understand the role and need of effective data collection and its equitable utilization, next I'm going to explain the crosswalk between public health, health equity, and the determining factors on a community's wellness. A community's general wellness often comes down to its health, the health of individuals. An individual's health outcomes rely on several opportunities, factors, and resources that shape the way, again, we live, we work, we play, and we age. The non-medical factors that affect health outcomes are called social determinants of health, or SDOH. When these social factors are negatively influenced by broader forces and systemic bias, a person's everyday life conditions suffer, resulting in things like limited health groceries to healthy grocery stores, unreliable access to transportation, utilization of hospitals like that you mentioned earlier, Senator Spearman, Improving health determining factors and indicators like the social determinants of health shape individual and community well-being and often arise through frameworks that begin with political determinants of health. The political determinants of health are the political and/or policy-driven systems that influence distribution of resources, opportunities, and power, ultimately affecting the health of communities. The political structures, processes, and decisions that affect the health of individuals and diverse subpopulations can advance health equity, or they can perpetuate health disparities. Resilient policies that promote inclusive economic development and reduce poverty or promote healthier built environments regardless of zip code recognize these determining factors of health and go so far as to incorporate them as part of their success indicators. Oftentimes in a municipal setting, without political will, there will be no policy. And without policy, there will be no programming, including the funding of resources required to lift the associated initiatives. And many political leaders require and decision makers require data-supported evidence to start this dialogue. Public health and health equity are integral to the considerations for policies that address health disparities and promote overall well-being. We at the Department of Health and Human Services work to promote the health and well-being of Nevadans through the delivery of or facilitation of a multitude of essential services to ensure that families are strengthened, that public health is protected, and individuals achieve their highest level of self-sufficiency. This is through taking actions that utilize the science and art of preventing disease, of prolonging life, and promoting health through organized efforts and informed choices of the goals of to achieve the goals of the day. And when a person has the opportunity to attain his, her, or their full health potential, and there is no circumstance that results in a disadvantaged status, we then see the potential of these social conditions being improved. These are also known as the achievement of health equity. There are many ways public health and health equity integrate into the influence of both the determinants of health and the political determinants of health. And I'm going to use the last part of my presentation to highlight a few ways that the Department of Health and Human Services uses and analyzes health data by demographic factors, for example, race, socioeconomic status, ability status, and identifying disparities and crafting targeted programming, policies, and action planning. To put it simply, data is made up of facts and statistics. These are collected together for reference and/or analysis. One of the highest uses of data is to analyze trends, denote gaps in service delivery, and create responsive programming and resources. As the largest provider of state public resources, the Department of Health and Human Services collects data for a number of reasons, as noted on this slide. In addition to some division-level capacity, the department has an internal unit that's known as our Office of Analytics. Per its mission, it provides the Department of Health and Human Service programs, our governor, this legislature, the media, and other interested partners a consistent location to request data to better understand and improve upon the performance of the Department of Health and Human Services programs, supported grant funding, and to drive policy and inform the public. The Office of Analytics has a very robust dashboard. We'll share a link at the end of this presentation. And as an example of the dashboards to which you can access information is their Nevada Health Profile. It's tabulated to reflect rankings of information. Information is summarized across a variety of health indicators, and they can be filtered by assembly, state, and congressional districts. This information can be then filtered along racial and other demographic stratification. In addition to the dashboard, the Office of Analytics also maintains a robust category of behavioral health, children and family, community health, and infectious disease and minority health, as well as veteran health issues. In April of this year, I would like to make mention that this office was recognized by the National Association of Health Data Organizations for transparency and information. Two pieces of statute that I would like to highlight are Senate Bill 109 and Senate Bill 341, both from the 21st legislative session. Both were aimed at promoting healthier living and accountability, showcasing examples of how the political determinants of health influence stratified data collection. Keep in mind that when data is collected effectively and utilized equitably, we as municipal servants can be accountable to the public, especially those who are negatively impacted at a disproportionate rate that results in health disparities and equities. Being accountable, as described here, has the additional benefit of lessening mistrust and once again increasing sustainability. Senate Bill 109 was established as a way to count and/or consider the population who was slipping through many health service gaps as demonstrated by the COVID-19 pandemic. This bill was codified under NRS 239B.022 through NRS 239B.026. And this legislation requires that governmental agencies that request from a person information related to their race or ethnicity to also request information related to this person's sexual orientation and gender expression. This bill created an opportunity for governmental agencies to identify service gaps for communities that are chronically undercounted and therefore chronically underserved. NOMI's equitable viewpoint may be very helpful in Senate Bill 109 related gap and trend analysis. DHHS, with participation from NOMI, conducted a comprehensive review of best practices and federal guidelines to ensure compliance, and then developed standardized questions as its initial step to action Senate Bill 109. The questions developed by the agency were then placed in an instructional memo that also required all of our divisions to complete an audit of their forms. This data gave the agency a snapshot on which forms required change and any challenges that they would anticipate. This process was viewed valuable by other departments of state government. The result of the audit was reported in Senate Bill 109's first reporting cycle, December of 2023. Two supportive measures undertaken by NOMI included holding a community listening session to explain the pending impact on intake protocols and to also gather community reaction and the creation of these. And we also are in the process of creating a culturally competent training module for DHH personnel to ensure that they are prepared for the task of doing intake and data collection. So in comparison to Senate Bill 109, Senate Bill 341, established in the same year, focuses on how a governmental agency as large as the Department of Health and Human Services goes about collecting, reporting, and implementing data collection. Reports required through NRS 439.259 and NRS 439.359 will focus on how data contributes to the legislative actioning and implementation through reporting. Senate Bill 341 requires that the Department of Health and Human Services provide to the legislature or the Legislative Council Bureau 2 reports that discuss allocation of funds that support health care services, behavioral health services, or other services that promote well-being. What is services provided? It also reports out on the efforts made to locate persons in need and the number and demographic of those persons served. While 109 describes a specific category to collect information, Senate Bill 341's general overview of allocation of funds and services provides us a chance and you as legislators to review how our agency is prioritizing communities and services within the health and wellness space. This includes the provision within the specified NRS that names philanthropic and grant-making activities to augment programmatic funding. This recognizes that the finite resources currently available require other avenues of funding. With effectively collected and equitably utilized data, the financial protocols of SB 341 could be modified to ensure a proportionate response to service delivery. Now that we've touched on those two examples of how legislative action can support and directly impact data collection efforts, I'm going to review the future possibilities of data utilization and collection. If you recall from a previous slide on the social determinants of health and the political determinants of health, communal and individual health is influenced and shaped by more than just the physical status of a person's body. The way we track the influences, the impacts, and the gaps of the factors based on social structures and policies is rooted in effective data collection and its equitable utilization. In order for Nevada to achieve this effective and equitable use, we will have to do a few things. We'll need to strengthen and close gaps on stratification of data resources, collection, and content. We'll need to increase culturally competent and responsive training. We'll need to incorporate intersectoral data management and trend analysis into community education and awareness so that they understand the importance of this data. And we'll also need to secure funding streams to augment capacity building needs and service implementation. This will all result in systemic changes, increased community trust, and more responsive and culturally sensitive programming and service delivery. It will also result in effective evaluation of trends and noting service gaps and the needs to close the intersectoral needs of our community. All of this will ultimately contribute to a strong and healthy Nevada. So because of the nature of this committee, I'd like to leave you with one example, one working example of how effective data collection and equitable utilization could potentially, in fact, impact the space that you serve within commerce, labor, business, and health. Let's say that there's a large wildfire in northern Nevada, where there is a large fire spanning over 6,000 acres that is threatening a populated town. The emergency response to this wildfire would require several things, almost all of which would require data or the collection of facts and information. In a town or state's recovery after fire, there are several social and economic considerations. How many people were located in the emergency alert order? How many had homes that were underinsured? Was the insurance proprietary? Was it cost prohibitive? What about the health insurance that will be needed as an aftermath? If sheltering in one central location while waiting to move back home, is there a disease management protocol in case of an outbreak? How will public information be distributed? Is the access to the data dashboards that manage and track our wildfires accessible by persons with disabilities or for whom perhaps English is a second language? Is there food access? How can we as a state ensure that we're going to be able to provide internet connection, which is so vitally important? And in preparation for the next fire, have epidemiologists been included in the planning process so that those syndemic impacts can be identified and minimized? And these are those factors for which there are 2 or more resulting diseases that are exacerbated by the emergency at hand. If you have someone who is underinsured, who is below the federal poverty line and living in a rental property, or is a business owner and is a sole income provider for their particular family, what will be the recourse and are they aware of it? What are the other ways to prevent, or are the other ways in previous and current data that was collected applicable to this situation? And how can it be utilized to make sure we alleviate all those intersectoral impacts? I'd like to point back to the document that NOMI has created, our Health Equity Action Plan. It includes a case study on emergency preparedness, and it was created in part with association through a focus group from the nationally recognized Minority Language Warning and Information Project. This particular project and this particular information we think would be valuable if you wanted to delve deeper into this topic. And while emergency response is merely one example, at its core, data eases the path for state agencies like the Department of Health and Human Services to support actions and mitigate negative impacts while we are still addressing these behavioral health disparities among very diverse and vulnerable populations. And we believe that by NOMI providing an equity lens, we believe that we can then have a solution that will benefit all of our community and residents. Madam Chair, this is the contact information for my agency. As a reminder, my name is Tina Dortch. I am with the Department of Health and Human Services. These are a few acronyms that are provided in the handout that you have at your disposal. And I will leave the slides at the particular information for our data dashboards in case anybody wants to contribute to that or to download that. And Madam Chair, I am available for questions.
Thank you, Ms. Dortch. Are there any questions, committee members? Senator Stone, any questions? No? I just have a couple. I guess the first, let me start from where you ended, because I guess I hadn't thought of it in terms of how the data that NOMI collects impacts the rest of the state and a number of the things that we face. And I'll go to the example that you gave with wildfires. We take wildfires, and 341 is a direct result of what we did not do during COVID. And so do we have the reporting that is required in SB 109? The agencies were required to make sure that whenever that those questions, certain questions were on their either application or work website, that they would include. People were not obligated to give that information in terms of sexual identity, but the agencies were obligated to put it on there. How well or not are we doing with that?
Thank you, Madam Chair, for the question. This is Tina Dortch. We have produced, as I mentioned, our first report per the requirements of the legislation, and that was produced in January of 2023, I believe. And we will be looking forward to the next round of information. The first set of data that was collected, Senator, merely talked about the results of our audit. We were looking at the plethora of forms that an agency like the Department of Health and Human Service must produce and maintain to make sure that they would be compliant. So the first report only talked about the status of the audit. We look forward to having a little bit more robust data, and I'd be better able to answer your question if I had the second edition of the report at my disposal.
The other thing I want to highlight, because you mentioned FEMA, and I have a very good friend who is vice mayor of one of the cities that was hard hit by the recent weather. And she said one of the things that was important to them, and she's glad that they had it, was information, demographic information to hand off to FEMA so that they would know immediately which neighborhoods, which zip codes, that sort of thing, they would need to get to first, and how much, and be able to estimate about how much that there may have been. And so I guess one of the things, and you don't have to comment on this, but one of the things that I suspect that there's a lack of understanding across the board when we talk about data collection, demographic information, and the intersection of the two, because for some reason we're having discussions about whether or not DEI, and some people use that as a curse word, but it's not. My definition of DEI is definitely earned it. And so when we look at the information that is supposed to be collected, and we're looking at marginalized groups, we're not just looking at marginalized groups from the standpoint of ethnicity and language, but we're also looking at them, or you're looking at marginalized groups in terms of low wealth communities, because that cuts across all of the other demographics.
Correct, Senator Spearman. I'm going to take the first part of your statement about the role for FEMA. My office has partnered with FEMA, the last time doing so during our COVID period, and their ground campaign is stellar. But they do expect, when they are in a community, to have reliable data so that they can continue that. Can you still hear me?
I can hear you.
It went silent on this end. So we absolutely have familiarity and history in working with FEMA, and I can concur and affirm the need for data in those scenarios. And I think the last part of your question was more of a statement, Senator.
Yeah, it's statements, and I think we have to grasp the gravity of the lack of information and what that means for the citizens of Nevada when we do have, and Northern Nevada particularly, with the threat of wildfires. And so I want to look at that. Let me suggest something to you. If you can get information and you can put it in report form so that you can get it to the legislature by January, or at least before the 2025 session is over, with regard to how well we are or are not performing with respect to collection of data. And the second thing I'm going to ask you of you is to make sure, and I know that there are people from the faith-based community that are represented on the advisory board, but I want to make sure that what we're talking about here in terms of data collection and interaction with the community, working with faith-based organizations, make sure that we're working with Department of Veteran Services, because I always ask this question when people come and present. Do you have on your intake applications, do you have a space there that asks the question, have you ever served in the military? Because there are some things, and even in particular, when you start talking about NOMI, there are some areas that the Department of Veteran Services can be helpful, and money that would be expended on that particular community can be saved and go elsewhere. And I'm thinking particularly about the vicissitudes of the PACT Act, or people who would qualify for the PACT Act, and some of the illnesses that they experience as a result of their exposure to burn pits and other toxic substances. So if you take a look at and ask collaboration with Department of Veteran Services, I'm also going to ask if you will talk with the Office of Grants. That office was created by a bill that was sponsored by Assemblywoman Danielle Monroe Moreno, and that was to look at grants coming into the state, either by request or just coming into the state. Take a look and see what can you access in terms of philanthropic funding through that office. And I know anytime you request a grant, it is based upon data. And so there may be some things that you might be able to do in NOMI that might be able to help the citizens or the homeowners that are, let's say, an incline village. And many people might not think that they need it. But if you're about to lose your homeowner's insurance, there might be some other things that might be costly to you. Am I making sense to you?
Yes, Senator. To trace back to one of your initial references to faith-based organizations, I believe that is a perfect intersection for the application of grant funding to help with capacity building. For so many individuals, organizations, or nonprofit groups that are interested in doing service delivery activities and need grant support, there's very little training that's available that they're aware of in order to get capacity to be effective at going after dollars, managing the life cycle of a grant, the evaluation responsibilities that come along with a grant. So I think if we take that to heart, and it was referenced in our presentation today, that we believe that there is a cross-section that would benefit from having that relationship with the office that you mentioned, the grants office.
I'm going to press you a little bit further to look at some of, when we say vulnerable communities, I'd like for us to look at what if any, assistance the Office of Grants could provide in terms of getting people trained in ASL and people trained in other modes of communications or methods of communication with the blind and those who are sight challenged. And it is in those other communities, i.e. faith-based community, Department of Veteran Services, and some of the other peripheral agencies, that I believe we might be able to find people with the acumen, but they've not been trained and don't have the talent to provide those resources. Because the people that came in on Monday and testified, they were very clear that when they go to the emergency room, and I can only imagine what it feels like if you cannot communicate. And one person gave us the example of being on a gurney in the hall for 3 days, and he was deaf and basically isolated physically and isolated psychologically. So let's take a look and see where some of those vulnerable communities, where we've got gaps there. Let's look at how the Office of Grants Management might be able to help with funding training that would be there. Grants Management may also be able to help fund some of the secondary or even tertiary effects of the wildfires that we've been experiencing. So I think what I'm saying here is I think that there is utility for the dashboard. I'm just not sure that we are using it to its fullest capacity. And I see this as a way for us to gather the information, especially demographic information that we will need but whenever a catastrophe happens and we need FEMA. I believe it also serves us well when we start talking about the CDC. It would serve us well when we talk about Department of Justice. And so those demographics, if there's a way for us to make sure that agencies across the board understand that the requirements of SB 109 and SB 341 were not something that was being done to them, but something that was being done for them so that they could more effectively service the citizens of Nevada. Does that make sense to you?
Yes, it does, Senator.
Okay. Thank you. Additional questions? Comments? Thank you, Ms. Dortch. We will move now to the recommendations from NOMI. I'm sorry, I got caught up in there. Okay. Okay, we'll come back to that. I see that we have one of our committee members that's absent. So just as soon as he comes back, then we'll go to that. And Ms. George, if you'll just hang around for a minute, just in case there's any questions during the discussion. Okay. So we pulled agenda item number 5 from the, and there were so many people that were waiting for that to be discussed. And we pulled it. So, so let's move now to agenda item number 6, presentation on Nevada Help Desk Cybersecurity and Apprenticeship Program. Mr. Juana Malone, Director of Apprenticeship Programs, and they are an apprenticeship program that is certified by the Department of Labor. And I learned of this, more about this program, I guess within the last couple of weeks, because there was someone, I believe, from Department of Labor or Department of Cybersecurity that came down to Nevada to talk about it and to talk about it with them. And so we are grateful to have this organization here in Nevada that is working in a very prominent way with the FBI and with other organizations and agencies to make sure that we fortify our cybersecurity efforts here in Nevada. And so with that, Ms. Malone, please begin when you're ready.
Good morning. Thank you. Thank you, Madam Chair and members of the committee. I am here today to share a presentation, as Senator just mentioned, on cybersecurity. And it's for our cybersecurity apprenticeship programs. Okay, and so a little bit about myself. I have been in the technology industry for over 35 years. And I serve currently on local, state, and national boards, all related to technology and workforce development. I also serve on the national level for the FBI, National Citizens Academy Alumni Association, as Director of Technology. I'm here as a very passionate member about cybersecurity apprenticeship programs, primarily because it's all about keeping ourselves, our family, and our nation safe. The presentation that I'm going to be sharing with you this morning will give you a little bit of information about this registered approved program from the Department of Labor. And the event, Senator Spearman, that you're referring to, it was the Executive Office of the President of the United States, the White House. It is an official White House initiative. The announcement was made 2 weeks ago. And so I'll be sharing locally on the opportunities that are available right here in our state. I do have the presentation, so I'll go ahead and follow along with you all. Just briefly, a little bit about Nevada Help Desk. I've shared a little bit about myself, and I'll be sharing a little bit about Nevada Help Desk. I heard DEI mentioned earlier in the presentation. That is heavily a part of who we are as an organization, as part of our core values. And I'll be talking about some of the most popular certifications offered as well. Our program design includes year-long programs, both in-person and virtuals, for student agents from opportunity populations, particularly in underserved communities. However, we serve everyone. We do not discriminate against a person's race, color, ethnicity, nationality, their religion, socioeconomic status, education, age, gender, gender expression, gender identity, sexual orientation, mental, physical ability, teaching them various in-demand technology applications to prepare the students for the workforce. Because we are a registered Department of Labor program, we cannot discriminate on age either, because there is no maximum age limit as a registered program. So no matter how old a student is, we still accept them into our apprenticeship program. The starting age is 16 years old, and they must have a high school diploma or GED to participate as an apprentice. If they're 16 or 17 years old, then they would participate as a pre-apprentice if they have not already graduated high school. Simply put, if you forget everything I talk about today, we train, we certify, and we employ. That's our 3-word mission. Our current, we already talked a little bit about diversity and inclusion. We are a full service registered apprenticeship program with diverse perspective, which is crucial to building robust, innovative, and successful teams. And we celebrate what makes each apprentice unique. We welcome what students have to contribute to the education and to the business culture. We believe that a student cannot truly bring themselves to the workplace if they are coming to an environment where they are accepted. Education is key to personally develop and thrive. I want to also make mention that when we first started off, we were actually headquartered in the former City Hall in Las Vegas as a program in partnership with the late and great Tony Hsieh. When our program first started, we were housed at Zappos. Just a little fun fact about our history, and a notable mention about one who was one of our original supporters and partners of this program. Nevada Help Desk apprenticeship programs. Again, we train and certify, and you may ask, well, what did you train and certify in? All of the global major brands, such as Microsoft, Adobe, EC Council, CompTIA, are those programs that we primarily certify in. The statewide goals that the White House Office of the Cyber Director mentioned 2 weeks ago publicly was that we will be hiring 750 apprentices over the next 3 years, which is an average of about 250 per year over the next 3 years, either internally or externally through our employer partners, with us being the apprenticeship sponsor. The key activities that we focus on right now as a registered program in the state of Nevada through the State of Nevada Apprenticeship Council, those that are registered right now are digital marketing and cybersecurity, as well as computer user support. Just sharing a little photo here because we do, aside of my national role on the board for FBI, National Citizens Academy Alumni Association, we do partner with our local field office every year with providing opportunities to students to participate in a customized teen academy in conjunction with Nevada Help Desk. And that is in the picture there, our former special agent in charge at the FBI Las Vegas field office. Resources provided to all participants and students, automated database industry experts, 24/7 online portal, software tools, consortium members, and funding. We are a state of Nevada service provider as well on the eligible training provider list, and we service both Northern and Southern Nevada students. I serve as Director of Apprenticeship Programs. I don't know if I mentioned that earlier, but I just wanted to share and say thank you for the opportunity to share this information about our Nevada Help Desk programs. There were packets that were left at the front table for anyone that wants additional information. Our website is nevadahelpdesk.tech. That's nevadahelpdesk.tech. A quick, simple, big picture overview is also made available. I'm not going to go over all of that in this presentation for time's sake, but simply put, again, we train, certify, and employ, and it is a very simplified process for a student to get started as an apprentice right through our website with just a simple click. Our contact information is available as well in front of you through our presentation slide, which is our final slide. And I want to say again, thank you once again for allowing me the opportunity to speak. And I just noticed one correction here. We're now open 7 days a week. So it says Monday through Saturdays, but we serve our apprentice because of popular demand 7 days a week from 7 a.m. to 7 p.m. And that concludes my presentation. Thank you once again for the opportunity to share.
Thank you. Committee members, any questions? Yes, Assemblywoman Torres.
Thank you. Just a quick question. If you could give clarification, is this like a state program or is this like a business model that's then used to like support the community, or, and if so, how much, what is the cost to students and to adults?
All of the above. As a state of...
State your name.
Oh, for the record, Duana Malone, for the record. As a state training provider, we are WIOA funded. The students are a part of the WIOA funding that are eligible through the state of Nevada. So we are a eligible training provider and on that list for Nevada. And so we are a state training provider. We also partner with school district, City of Las Vegas. There's a whole, I don't want to name drop everyone, but we partner with a lot of private, government, and public entities to provide opportunities to the students through a great example is City of Las Vegas. This is our, I want to say 6th or 7th year. We offer internship programs. We partner with the school district. We provide usually 20 to 40 apprentices for them that are hired by us that we serve on different projects with school. And the list is way too long. I don't want to name drop everyone, but there's many community, private, public, and government entities that we partner with to provide these kinds of apprenticeship opportunities to our students.
So to follow up, just so like that after school program that you have, I think it's mentioned in the slides and then you brought it up again. So how does that look like for like a school? Do the schools pay to receive the services or?
Yes, so we currently have a contract with the school district. And so the school district actually pays Nevada Help Desk, and then we hire students to serve as on different projects for them. So it's kind of two-tier. Our relationship with the school district is kind of multi-level, if you will, because when we host our technology summits throughout the year, we have what's called cybersecurity boot camps. Those are kind of separate than the contract that we have. The contract that we have is more of a workforce development project for specific service needs. Our other part, which is our partnership with their actual STEM office, is more of them providing opportunities to the students throughout the district so that they can get trained, certified, and employed. And if they qualify, they can take advantage of the services that are offered through Workforce Connections, through Employee NV Youth Hub, through those state support service providers. And to answer your last question, no student has ever paid in the state of Nevada out of pocket. So because of collaborative resources, even through partnering nonprofit organizations, organizations such as Verizon, Anthem, back the students. If they don't qualify for WIOA, then we have those kinds of organizations through their grants that will offset the cost for a student. But in the history of our existence, no student has ever paid out of pocket for any of their technology program, training, certification, and we definitely, it would be illegal for us to charge for them to get hired. We're not like an employment agency, so those would violate our Department of Labor standards. So we can't even charge a hiring fee or employment fee. Those would violate our apprenticeship standards.
Senator Lang?
Thank you. I think this is a great program, and I'm really excited to learn about it. I'm wondering, you mentioned that you have partnerships with school districts and other organizations. How do you advertise to get more involved?
Well, through word of mouth, actually, because right now there's over 1,200 student registered. We partner with the CTE office at school district and also universities. We don't just partner with high school. We're partnered with UNLV, the CA community, their CAEO, the acronym Community Outreach, and also CSN. So we're not just high school partners. We also partner with post-secondary as well. In fact, when the White House was here a couple of weeks ago, that's where we were when they made the announcement at CSN, when they made the announcement about our commitment and initiative. And so it's just word of mouth, believe it or not. I will say when we first started, thanks to a grant by the Governor's Office of Science, Innovation, and Technology that we were awarded under the past governor, there was a grant that was awarded for us to create that talent pipeline management system. And in that grant were an advertising and marketing budgeted. So when we first started back in 2000, that grant was received in 2020, that had quite a substantial advertising and marketing budget. So the word got out. And then since then, it's just been word of mouth.
And could you talk to me a little bit about the ethnicity type of students that you're getting? And you obviously have collected some data over the years about where you're getting kids that want to participate.
Yeah, that is so interesting that you asked that question, because one of the things that we're most complimented on is our diversity. If you look at our website or see any of the media, because we've been in the media quite a bit, all of our photos show a diverse group of people from race, religion, all of that. And like I say, because it's word of mouth, the first group that we started off when we were at Zappos, through word of mouth, their friends, their family, it's just literally, friends are just attracting friends of the like mind, like ethnicity, like religion. Because again, since the 2020 initiative under the previous governor, we have not done any targeted advertising or any of that. It's just been word of mouth. And I will also say though, and this may contribute to that, to answer your question, we have joined and were members of all of the chambers. So I'm sure that played a part as well, as we were, when we had the marketing budget, got the word out to the Hispanic chamber, the Asian chamber, all of them. So we did not just target one particular ethnic group, and I'm sure that may have played a part as well, because we had corporate memberships to all of them during that time when we had those budgets. And then since then, it just kind of grew a life of its own.
Thank you. And do you mind if I continue? Have you reached out to the tribes at all?
Well, coincidentally, the director at Verizon who supports us is the director of the tribal nation. And so even part of their, I don't want to say their data collection, if you will, is tracking what kind of ethnic groups that we have as well. And so, yeah, coincidentally, who her last week is actually next week, but for the last so many years at Verizon, the director is, just happens to be director of the tribal nations. And so one of our biggest supporters as well. So.
Yeah, we have seen a really great response to the education grants that we have given the tribe.
Oh,
And so I would see this as something that would be really interested, that kids would be interested in doing.
well, I'd definitely love to learn more about that. And I'm sure because Cooley, it's very active in the community with the tribal nations as director. So if there's more information I can get from you on that, otherwise, I'm sure Cooley, I'll bring that up to her and she would, I'm sure, know about those educational grant opportunities. But I'd love to learn more because we haven't done an active campaign for them. Like I say, just word of mouth. So whoever Cooley, and that's her name from Verizon, has told, and that's public information, by the way. She's announced already her departure from Verizon. But whatever resources that she has given in the past, if we can expound on that, I'd love it. I'd love that.
Great, thank you.
Mhm.
Thank you. I think Senator Stone has a question, but just before we go there, the White House Office of Cybersecurity was here, and I don't know if you mentioned there was an announcement made that you were getting a grant or being awarded. Can you speak to that for just a minute? And I don't know if you said it or not, but I think it's important for us in terms of learning what is available through your program.
Yes, thank you for that question. And when Director Coker was here, he did not mention the grant funding that was available, just the job commitment. However, we are, because we are in cooperation with the Department of Labor, we are recipient of several grant awards, both as direct and subcontracts of, for example, the Good Job Grant, that was $500 million. For that grant. Recently, the state of Nevada also announced that from the new governor's office of workforce innovation, we were awarded, it was 1.4 million. We haven't seen it yet, but we did get that notification and they're doing some final modifications with the Department of Labor. And so, but the one that we currently have is part of that national through the Department of Labor Good Jobs Grant, and that was $500 million nationwide that we are a sub on. We also are a sub of, there was a recent announcement for the, it was up north, the Northern Grant, and that was part of, I want to say EDA, don't quote me, but there was one that just came out about a week or two ago that we were also a sub on. So there's various grant opportunities. Oh yeah, and then there's one more in cooperation with the Institute of American Apprenticeships. Every student that has a barrier, whether it is healthcare, childcare, a minimum of $1,000 will be given to each of them for helping them to participate in the pre-apprenticeship program. And so I'm sure I'm missing some, but there's several grant applications that we're a part of that allows us to have funding for the students, in addition to the Workforce Innovation Opportunity Act that I mentioned earlier. And those funds will go up to $8,000 per student who are eligible, whether they're veteran spouse, homeless, whether they meet one of the categories that makes them eligible, domestic abuse survivor, all of those are factors considered with eligibility. And those grant fundings through the WIOA Innovation Opportunity Act are up to $8,000, which covers the cost of all their tuition, certification, and exams. So there's a lot of resources available.
Senator Stone? Thank you.
Thank you, Madam Chair. Good morning, colleagues, and thank you for the presentation. It's great to learn what you're doing there in the cybersecurity areas. You talked about 750 positions in the next 3 years. Are those, number one, are those both public and private? And then, you know, we have seen some horrific ransomware situations, not only in the public sector, including government. I know for a fact that the Los Angeles court system was hacked. They were down for like 10 days. They were ransomed. They didn't pay the ransom. We've seen casinos in Nevada that have been hacked and have been ransomed, some paid, some not paid, cell phone companies, social security numbers coming out. Are you satisfied that the partnership that you have with the FBI and other federal agencies is providing you providing your students the most up-to-date advances in how we protect our governments and how we protect our industries from these nefarious intrusions that are exacting hundreds of millions of dollars, if not billions of dollars, globally from vulnerable companies that really believe they have good walls, cyber walls up. But boy, these people are getting really sophisticated and are breaking through. And I just want to just learn more about, what your students are being taught. And then at the end of the process, how are they certified? So if, let's say, one of our casino partners wants to hire somebody to try to prevent what we've witnessed in the past year or two, what is the certification that your students will have to say, hey, I'm qualified, I've been well trained, I'm state of the art when I go to work with you and try to protect your data?
Senator Stone, wow, thank you so much for that loaded question. I'm so passionate about how you phrase that question, and I'll address each one of those areas. And I'm so glad you brought it up because I would have left here without mentioning one of our biggest partners, Caesars Entertainment, who we partner with. They're, in fact, over the summer, all of their top security officials spent a day with our interns to really give them insight. And it's just an amazing, they partner not just on that level, but through funding, the nonprofit. I mean, they've been a partner for many years. So thank you for that, because I would have left here without mentioning them. But I will say, and it's all about preparing the next generation of techies. You mentioned FBI and the level of support and participation they're giving. Thank you for that question as well, because ordinarily outside of our commitment, they give like a half day teen academy or so. But with our commitment, it's for weeks that pan over several months. We have the top security officers of our FBI Las Vegas field office that is training our students and preparing the next generation of techies. So it's not even just a half day. We literally not only spend summer months, but also City Hall, when they're closed, always the Friday, this is our 7th year before the Friday before the Martin Luther King holiday, FBI and our organization, along with other tech agency, we host 600 to 650 students, both the upper and downstairs level, with nothing but cybersecurity training and all day and exposure for those that we can continue to increase. This year was one of our largest. We had about 650 students there at the Las Vegas City Hall, and the entire chambers and downstairs was the FBI time. And so they're doing real life. To answer your question, how up-to-date information, it is up-to-date information. And even sharing information about our seniors, which is one of the most vulnerable population. And because of that, I didn't mention this earlier, but throughout the summer, our students also go to sites such as the Martin Luther King Senior Cities and educate the seniors. So the information that they have, and also Lutheran services. And there's so many organizations that they are tasked with sharing the information that they learn. So not only are they learning and applying what they learn, but they're sharing with our most vulnerable population, such as Lutheran services and OK Seniors. And we've done that for several years. And lastly, I will say that when you say what kind of certifications, these are globally recognized certification. And I failed to mention, I actually started when I was these students age 18 with the Department of Defense and Department of Energy. So my background in government passes over to them, which I still work with several departments on the national level. So these students are required to have a Department of Defense controlled unclassified information certificate. So, and so to answer your first question, and I'll close with that, to answer your first question, these jobs are for private, public, and government contractors. We are a part, I'm an official part of the Department of Defense ecosystem. So we're intentional about filling those jobs for and with the Department of Defense contractors, everyone that's doing business with the Department of Defense to make sure that they also are keeping their information safe. Forgive my loaded answer, but it was a loaded question.
Yeah, I was, and I just want to say that I'm very impressed with what you're doing, because we need to ensure that we have the best protections and the most educated people to help protect our private industries. I mean, our casinos, as you know, have been really hit. Our car dealerships have been hit. Our banks have been hit, and I think we hope that you can serve as a model for protecting the public and private sector with these wonderfully educated people that you're putting through and getting these incredible certifications. So thank you very much for the presentation, and continue good luck to you and your students.
Thank you, Senator Stone, and to the committee and Chairman. Thank you, Chairwoman.
Thank you.
Yes, ma'am. I'm trying to wrap my head around exactly what you're doing, because the world I come from, which is the trades, construction trades, that it's typically a partnership between management and labor, and means earn while you learn. What is the earn while you learn component of your program? I'm not hearing that clearly. Could you explain that?
Yes, thank you. Wow, I'm loving all these questions. Because we are a registered apprenticeship program with the Department of Labor, we have a 3-tiered level salary that we're required to pay. For example, we're talking about cybersecurity. We cannot pay any less than $25 an hour. This is all regulated by the Department of Labor. We have local and national standards that we're held accountable to. So the students, if they're computer user support, it's tier leveled. Once they start, and it's modeled after the construction trade, actually. So thank you for that question, because we have signed appendices to the standards that we sign and the student apprentice sign, that they are mandatory wages that we must pay to them. And so I gave you an example of cybersecurity, computer user support. I just happen to know offhand because that is who we have at our partnering location that are working on some of our partner sites. And we start them at $17 an hour, but they top out at, when they're at that 2,000 hour after the year, $21.50. So entry level. And then once they met competencies, you have your mid-level. And then once they complete that 2,000 hour, they top out for computer user support at $21.50. And for cybersecurity, they top out at $27.50 just after that 1 year. Now, here's the catch. For those that are working on our projects with the DoD subcontractors, that's just the minimum. They can make 30, 35. I had a 19-year-old making over $30 an hour. So they're not stuck at that 25. What the Department of Labor says is we can't pay them, any less than. So if they come with multiple certifications, like the case of this gentleman, if they come with multiple certifications and they have multiple years of experience already, then they are not stuck at that 25. They can make 30 and 30 up with our employer partners. So it really depends. And I have one gentleman, I'm not going to publicly say his name, but we just placed him at Nellis. He's doing $90,000 a year. He hasn't even been out of our program a year and a half yet. And he's at Nellis making $90,000 a year. Or it's like $87,000, close to $90,000 a year. He just got hired like 2 months ago. And I will say this also, if they're at that level working with one of our government partners, because we had their sign off on their clearance, because they have to obviously get a clearance, no different than I did back when I started with Department of Defense. If they're with government, they all are going through that security level clearance as well. But you're not limited. I use them as an example because they're not limited to that 25. He's making almost 90,000, which is clearly over $25, and just certified, not even, like I say, not even a year and a half ago. So they're high wages. All of our occupations are high wages, and not only are we regulated by the United States Department of Labor, but locally with our labor. Our state apprenticeship director, and the state apprenticeship council, we're also held accountable to them. They check in every quarter. I have a great relationship with our state apprenticeship director, who was also at that announcement by the White House a couple of weeks ago. So they do their due diligence and check in and make sure that we're doing what we're supposed to do.
Committee, additional questions? Comments? Well, thank you, Ms. Malone.
Thank you, Senator.
And I'm hoping that the information that you've shared with us today is something that we might be able to develop a little bit more, perhaps during the next legislative session. I think it would be interesting, especially as we look at the number of jobs. Would you say 750?
Yes.
Jobs?
Minimum.
Minimum. And so do you have an idea what that looks like? What does that translate in terms of economic development?
Well, oh my goodness, the impact will be great. And the good part about it is even if the employer is not in Nevada, which we of course try to fill employers here, the residents are. So that means creating more taxpayers for our state. And the reason I said minimum is because, and this is public information, both the Department of Labor and the White House both published a release not even a year ago that there will be, there are 500,000 jobs. They both say different number. One says 700,000, the others say 500,000. So I'll say between 500,000 and 700,000 in the cybersecurity industry over the next 3 years that will become available and are currently available. So in our state, as we fill those jobs, particularly with those government-related roles, I will say, once the final rule comes down for what's called CMMC, the cybersecurity maturity model, there are going to be 235,000 contractors that will need to be certified by cybersecurity specialists. So that's going to open up a whole new avenue of opportunities for our cybersecurity. And the ruling is expected to come down any day. It's right now in final rulemaking with our Department of Defense. And once that becomes final, then that's going to open up thousands and thousands. So to answer your question about economic impact, because you're going to have thousands of people now making high wages for our state, creating more taxpayers for this state. High wages mean more taxes.
Okay, thank you so much. Appreciate the presentation.
Thank you for your questions and for the opportunity.
Thank you, Ms. Malone. And now let's go back. I see we're all assembled here. Let's go back to the NOMI presentation. And there were a couple of recommendations for this work session. Request legislation to amend Nevada revised statutes 239B.026, 439.259, 439.261, and 433.359 to provide that reports required by these statutes are also submitted to NOMI and further analyze. NOMI shall analyze and identify gaps in health and human services delivered to minority groups in this state. Is the committee inclined to support these recommendations or amend them prior to a vote? Okay, shall I have a motion?
So moved.
Okay, I have a motion from the vice chair. Do I have a second?
Second.
Second from Senator Lang. Any discussion? All those in favor say aye. All opposed, nay. And the ayes have it. Thank you so much. And thank you, Ms. Storch, for your presentation. Okay, we'll move now to agenda item number 8. Overview of legislative health notes to inform policymakers about how proposed legislation may impact health and equity. Skipped over one. I'm sorry, Ms. Bossy. I'm so sorry. Presentation on 340B, drug pricing program to enable qualified providers to purchase drugs at a discount. Okay, we've got Ms. Bossy, Adam Parath. Okay, and please begin when you're ready. And I'm sure that this is something that is of great interest to a number of people, not the least of which are members of our senior community. Please begin.
Thank you, Senator. For the record, my name is Chris Bossi. I'm the Chief Government Relations Officer for Renown Health. I'm super appreciative today of you all being available and willing to listen to this important issue. Lucky for you, I have brought the experts with me, so I'm just here for moral support. With me is Adam Porath, our Vice President of Pharmacy Services, and one of the most educated people that I know relative to the 340B program. So take it away, Adam. Thank you.
All right. Thank you, Madam Chairman, and committee members. Again, for the record, my name is Adam Porath. I'm the Vice President of Pharmacy at Renown Health. I've been a practicing pharmacist in our state for the last 18 years. And we're going to talk about the 340B program. You may remember from the last session, there was AB 434 that dealt with payers who would be restricting access to the program or differentially paying for medications that came from 340B providers versus those that didn't have access to the program. What we're going to talk about today is restrictions that are happening with pharmaceutical manufacturers around the program. So quick review, what is the program? It allows discounted medications for a variety of covered entities within our state. We have disproportionate share hospitals like Renown Health and UMC, FQHCs like Nevada Health Centers, critical access hospitals all over our rural counties, sole community hospitals like Carson Tahoe, STD, TB, Ryan White, and HIV clinics, including the Northern Nevada and Southern Health District, and the one hemophilia treatment center that we have in the state. The program is administered by HRSA and the federal government, but it is supported entirely through the pharmaceutical manufacturers. The program was created in 1992, and the intent was to allow all of those covered entities that I just listed a way to stretch scarce federal resources as far as possible, reaching more eligible patients and providing more comprehensive services. So in that, the benefit is to the healthcare provider to be able to provide more wraparound services for their patients based on the fact that you're buying drugs at a lower cost, and you're getting reimbursed the same amount as if you didn't have access to the discounted drug prices. All manufacturers that want to participate in the Medicaid program are required to participate in 340B. So when we think about which prescriptions are eligible, only outpatient prescriptions. So in the hospital setting, that would be patients that we have in our emergency department, or discharge prescriptions that when patients are leaving, or medications that are provided in our outpatient service areas. But medications that are utilized for patients while they're inpatient are not eligible for the program. You can't just write the prescription. That can't be the only service that you provide to the patient for the prescription to be eligible. So you do have to have some sort of a tangible encounter with the patient as well in order for it to be eligible. So from 1992 up until 2010, basically the only way that one of these covered entities could take advantage of this program is if they had their own outpatient pharmacy. And as we heard this morning in public comment, a lot of our covered entities within our state do not have their own outpatient pharmacies. And so HRSA provided clarification in 2010 that covered entities could contract with pharmacies in their community, or with national pharmacies in the sense of mail order pharmacies, or with limited distribution drugs, things that are considered specialty pharmaceuticals. There may only be 2 or 3 pharmacies nationally that are able to provide a particular medication. And so in that case, covered entities can also contract with pharmacies outside of the state. So how does this whole contract pharmacy thing work? Basically what happens is that we, as the covered entity, agree to pay the contract pharmacy a dispensing fee. They handle the claim as they normally would. So they bill the patient's insurance. Whatever they get back from the payer, they give to the covered entity and we pay them back the cost that we paid for the drug plus that dispensing fee. So we get the delta between the drug cost, the dispensing fee, and what they got from the payer. That's how, in short, a contract arrangement works. So this went on until 2020. Right in the middle of the pandemic, there were 3 manufacturers initially who were the 3 main manufacturers of insulin in the United States that decided that they were going to restrict access to 340B to covered entities that were using contract pharmacies. This has been challenged. HRSA has gone to court with several of these drug manufacturers. There's still one pending court case, but right now, the 2 federal court cases that have happened have said that HRSA really doesn't have the authority to make rules around this. And so as this has developed, now we have 32, I think it's actually up to 34 manufacturers that have some sort of restriction in place. It may be you can only contract with a pharmacy that's within a certain mile radius. It may be you can only have 1 contract pharmacy, but they're not standardized across. So every manufacturer has different rules around how you have to handle the restrictions that they have. The problem with this is that, as I mentioned, there are certain drugs that are only available through contract pharmacies. So there's no access for certain specialty medications at this time. As a result of these restrictions, several states have enacted state-level legislation to prohibit manufacturers from not allowing contract pharmacy relationships in their states. So to date, there are 8 states that have passed state-level laws, and these laws are working. If you look at the new restrictions or the clarifications of the restrictions that come out from the manufacturers, they will say these rules apply everywhere except for these 8 states that have these laws in place. The Arkansas law, which was one of the first, was challenged in court by one of the manufacturers, and that ruling just came out in March of this year that upheld the Arkansas law, that basically said that the state is allowed to regulate this. Right now, there are 20 states in this year that have considered or are considering a state-level law around contract pharmacy relationships for 340B covered entities in their states. There is model language that has been created by the American Society of Health System Pharmacists and 340B Health, which is a 340B advocacy organization at the national level. And we would love to see in our state a bill similar to that model legislation. And the key concepts are really simple, that we would have rules that would prohibit manufacturers from restricting contract pharmacy relationships in our state. And if manufacturers chose to do so, that we would penalize them. And so that is it. What questions do you have for me?
Members, questions? Okay.
Thank you, Chair. I was just following up. It seems like I've heard some controversy regarding some of these entities contracting with the pharmacies outside of their state. And I'm just curious, does Renown have contracts with pharmacies outside of the state? And if you do, how many, and why are you doing that versus staying in state?
Yeah, certainly. So currently we have 85 contract pharmacy relationships. So that covers all of the local chains that you could think of. So the big chains, CVS, Walgreens, that are in the Reno community, as well as some of our outlying communities, because we're a rural referral center. So we're contracted with pharmacies across northern Nevada. I think we have like Walmart and Elko, Winnemucca, some of the main ones that we would see there. But to your point, the out-of-state pharmacy relationships that we have are solely with those specialty pharmacies for products that we can't carry at our own internal pharmacy. We do have 3 retail pharmacies as part of Renown Health, and we can fully take advantage of 340B when we fill our own prescriptions. But there's certain medications that either the payer says you can't fill it here because they want it filled at their own vertically integrated specialty pharmacy that they have. So if we use the example of, let's say, an Anthem Medicaid patient that comes to our facility for cystic fibrosis, we can order the cystic fibrosis medication. However, virtually every payer in our state says you can't fill that. You need to send that. If we use the Anthem Medicaid case, they're going to say you need to send it to their vertically integrated specialty pharmacy, which is CVS Health outside of the state. So if we want to have any 340B benefit come back to the organization for that particular prescription, we would have to contract with CVS Specialty Pharmacy in that case. So yes, we do have some contract pharmacy relationships out of state. Probably of those 85 that we have, I'd say there's 10 of those are out of state.
And those are all for specialty type?
Correct.
Thank you.
Yep.
Vice Chair?
Thank you, Chair, and thank you so much for being here today in the presentation. Just trying to wrap my head around your space. So how does your facility, or in this case, a contracted pharmacy, differentiate between a 3040B drug from a drug dispensed for a commercial payer? Does that make sense?
Yeah.
Okay.
Yes, it is super complicated. So.
And so just so I can finish my question real
Yeah.
quick, because obviously the drug is coming from the same manufacturer. Oh, correct?
Correct.
But under the law, it's supposed to serve 2 different populations of patients.
So for the record, Adam Porter, thank you for the question. The way that this works is that we replenish medication to the contract pharmacy. So let's just say, for ease of simplicity, that a bottle size is 100 tablets. After there are 4 eligible prescriptions of 25, we would then send them a bottle of 340B medication to replenish their stock at the contract pharmacy. This is all handled through a virtual inventory platform, so that we can see the prescriptions that are coming into our contract pharmacies and match them up to say, this one is eligible for 340B, or nope, that wasn't our patient. And so we're able to keep track of when we would need to replenish them with 340B medication from us as the hospital.
Thank you, and thank you for that answer. Thank you, Chair. Just last question. How do you make sure that these facilities are not the intent of the program, especially since you're using pharmacies that are not close to the entities? So for example, like Renown.
Yeah. Thank you for the question. Again, for the record, Adam Porth. So it is the covered entity's responsibility to maintain the integrity of their own program. And so we have a pretty robust audit system that we go through for the contract pharmacies. We audit 100% of the prescriptions that are filled at our contract pharmacies to make sure that there isn't anything that's coming through that might result in what would be called a duplicate discount. And so that's where we would utilize 340B on the front end, and the Medicaid would be pursuing a rebate on the back end. And so we really want to make sure that that's not happening. It's specifically prohibited within the 340B statute. And so it's on us to make sure that that doesn't happen. And if everyone sneaks through, which does happen every once in a while, we reverse those claims. And so within that virtual inventory that I described, we would decrement that amount of that prescription.
one question. Thank you, Chair. So, promise last one. So I guess there's some checks and balances in place. There's some reporting requirements that are probably extensive.
Yes, yes. Thank you for the question. Again, for the record, Adam Porth. Yes, there's you are required to do an external audit on all contract pharmacies annually as well. So beyond what we do internally, we have to have a third party verify what we have going on. We routinely report what we are utilizing our 340B savings for. So, Renown Health, by last record that I have, provides over $85 million of uncompensated care to patients in Northern Nevada. Last year, our 340B benefit was $40 million. So it really helps offset some of that uncompensated care that we provide. Specifics that I can point to, we have what we call our meds to beds program, so that we offer medications to patients before they leave our facilities, because as I said, they may be going to a rural community when they leave that may not have the medications that they need. And within that program, we offer it regardless of the patient's ability to pay. So if they have a very high copay or they don't have any coverage at all, we fund that charity care for meds to beds through our 340B savings that we get. We also have a Medicaid clinic that is part of Renown Health that operates at a loss all the time. And so we're able to support that clinic through the 340B savings that we have. And, we're the only children's infusion center in Northern Nevada. We're the only place that you can get chemotherapy in Washoe County that will accept Medicaid and Medicare. And so there's a lot of services that we provide. When somebody walks in our doors, we're going to treat them. And so if we have an inpatient that we know that we're not going to be able to use 340B medication for, but it's the right thing to do, that patient's going to get the medicine. There's a lot of medications that are not separately reimbursable for an inpatient. So if you have somebody that maybe, let's just use the example of, they just don't have a pay source, we're going to provide the care, and we can do that because we have access to this program today.
Thank you, Senator O'Neill.
Thank you, Chair. I've had multiple conversations on this 340B programs. I swear, every time I hear it, I get a little more confused. I have one very quick question. How long has the 34B program been in progress or been instituted?
Yeah, thank you for the question. Again, for the record, Adam Porth. The program was started in 1992. Renown Health first started participating in the program in 2009. And I think we heard public comment. There's new entities that within our state. I don't know the number in total of participating covered entities within our state. There's a lot. Every rural hospital is participating.
I'm just curious how long we've had this, and all of a sudden it has come up to a major topic of discussion in multiple places where I go. So why is this so controversial program? Can you make it in a short statement back to me? What is the big controversy that I hear on this?
Adam Porth, for the record, the reason I believe, and this is speculation on my part, is that this is, it cuts into the profits of pharmaceutical manufacturers. And so they really don't like the program, and they've looked for ways to minimize the financial impacts to them. And so if they can limit our access to 340B, the average discount that they provide under the program is anywhere from 35 to 50%. So any prescription that they don't have to include in the program is more profitable for the manufacturers. And so there's been more and more pressure. And I think that, as I said, since 2020, when they first started testing the waters of, can we do this? the more manufacturers that are getting away with it, the more that we are seeing that are trying to put restrictions around the program. And as I said, at this point, it seems, based on the court cases that we have at the federal level, that without federal legislation that would boost up HRSA's ability to rein that in, that we're going to continue to see these restrictions expand short of state level legislation.
May I ask one? You may not be able to answer this, and I appreciate. So it was basically the insulin issue that caused the attention to it. So is that fair to say?
I believe so. I mean, as I mentioned, the first three pharmaceutical manufacturers that chose to restrict access just so happened to be the three manufacturers that produce all of the insulin in the United States.
And we meet, as you well know, the legislature meets every other year here in Nevada. How many other states, if you know, have pending legislation similar to ours addressing the 340B? Whoops. You've talked about the 8 that have passed.
Yeah. There, again, for the record, Adam Porath, in 2024, there are 20 states that have considered or are considering legislation. So I don't know how that's going to end up. The 8 states that I mentioned were prior to 2024, but there may be more by the time this year is over.
Thank you. Thank you, Chair, for the time. I appreciate it.
Thank you. Senator Stone, you have a question?
Yes, thank you. Can you hear me okay?
We can hear you.
Okay, thank you. Thank you for the presentation. And let me first say that I'm a very strong supporter of the 340B program, especially here in Nevada. I think that you would opine that, especially in the rural areas, if we didn't have the 340B program, you would probably see seeing health centers closed. And, you know, I know often that, you know, Big Pharma likes to be vilified. Big Pharma isn't adamantly opposed to 340B program because actually they benefit from the 340B program in many ways, because you have patients that are in a hospital that are getting 340B medications, and they may be discharged from the hospital and go to a contemporary pharmacy that is going to get, or they're just going to have to pay that pharmaceutical company the true average wholesale costs minus a discount, like all other pharmacies do. I applaud nonprofit hospitals like Renown, and even the for-profit hospitals that, you know, anybody that walks through their doors, and you know this, sir, you can't deny service to anybody if they come in with any kind of a medical emergency. You've got to treat, and the first question that you ask them cannot be, are you covered by any kind of insurance? You have to treat the medical needs immediately, and then you ask questions later. And so I applaud hospitals like Renown and other hospitals in Nevada that provide a lot of free services. And probably over the past 5 years, you've seen that number exponentially grow. The advantage that you have being a nonprofit is that you can have a 340B program that can help subsidize the healthcare services that you provide needy people within the state. But I would think probably one of the biggest concerns, and you've addressed it certainly with your company as far as audits go, and Assemblywoman Marzola asked a very good question, you know, how do you differentiate the inventory that you dispense for a regular customer versus a 340B customer? And I would say if there's any concern of pharma, it's not that they're participating in this program, that I think in the end that they are doing their philanthropic efforts, but I think they're getting paid money on the back end. It's the issue of diversion, that there are pharmacies in this country that are having these mixed inventory systems that are skirting the issue. And you talk about 50%, sometimes it's even much greater. And when we're talking about 50%, sometimes we're talking about drugs that cost thousands of dollars. And I think you'll agree with that. So, you know, when you talk about that kind of money, And unfortunately, the federal government doesn't have the best oversight over the 340B program that we would like them to do. I mean, I appreciate all the audits that you do, but maybe you can talk about some of the diversionary practices that you've seen and how you've mitigated it at Renown. And I think if pharma has the comfort levels to know that it's truly being used for the purposes of augmenting healthcare in an environment where hospitals sometimes don't even get a proper reimbursement, especially with Medicaid patients to cover their costs, that if you didn't have this program, sir, where would we be in rural areas in Nevada without this program?
Yeah, thank you, Senator Stone, for the question. Again, Adam Porth for the record. When we talk about diversion, as a pharmacist, I think of people taking controlled substances and stealing them out of the pharmacy. But obviously, in the sense of 340B, it's something very different, and it's when you would allow 340B medication to be utilized on a patient that doesn't qualify. And so, again, the contract pharmacy is the place where that can happen the most, because you are not in the direct control of the inventory, and you have to rely on the virtual mechanisms that you have. The thing that we worry about is the duplicate discount, and as you mentioned, the pharmaceutical manufacturers, they don't want to pay the discount on the front end and be asked by Medicaid at the end of the year to pay them a rebate on that same medication. I think we can all agree that that's not fair. And so the onus is on the 340B covered entity to make sure that that doesn't happen. In the cases when it does, the covered entities, they've got to make it right. And so they either write a check to the manufacturer for the difference in the cases that I'm aware of, or for the next X amount of product, they have to buy it at wholesale instead of the 340B price to make up the difference. But to your point of who's keeping track of that, the Office of Pharmacy Affairs at HRSA is a very small organization. And so they have not even audited themselves all of the covered entities once. And so to your point, the pharmaceutical industry has taken it upon themselves to either request that they can audit entities on their own through HRSA, which happens, as well as they do what are called good faith inquiries, where basically they will just come to you and say, we see a purchase pattern that we think is problematic. We'd like you to explain what's going on here. And it is just that. It's a good faith conversation between you as the covered entity and the pharmaceutical manufacturer. I can tell you that I have had 6 of these since December with various drug companies, where they just come up out of the blue and say, I want to talk about this particular drug. And you go through the entire process. You show, how things are qualifying. And, in one particular case I can point to, maybe you can appreciate this, Senator, as a pharmacist. The situation was we had switched our preferred thrombolytic therapy from Alteplase to Tenecteplase. And the manufacturer wanted to know, why all of a sudden are we buying so much Tenecteplase, and why is it all 340B? And so, walking them through that, sometimes can be a chore, but, we're trying to run a compliant program. So.
And then just lastly, and thank you for your answers, I really appreciate it. You talk about these outside contract pharmacies that you audit. Have you come across any of these contract pharmacies nefariously diverting, if you will? Again, we're talking in some cases not just hundreds of dollars, but we're talking thousands of dollars. So there's certainly a financial motivation by somebody that may not want to follow the rules. Have you admonished a contract pharmacy and ceased to do business with them because you've seen some of these trends, or have you found most of your contract pharmacies to be compliant?
again, for the record, Adam Porra, Senator Stone, thanks for the question. I have not seen anything that I would consider to be nefarious. I think that in my experience, when there is a claim that is ineligible, it's simply due to the pharmacy not being able to recognize the difference between let's use the example of an Anthem commercial plan and an Anthem Medicaid plan. And so it may be just that their system is not sophisticated enough to get down to the group level to be able to screen those things. And again, that's why it's back on us as the covered entity to make sure that we are maintaining the integrity of that. And so, as I mentioned, we audit all of those claims, but it does happen, every now and again. It's not very often, but usually it's just one single prescription that sneaks through. It's not like I've seen a store that we've seen a trend that this particular pharmacy, at least that's not been my experience.
And then just lastly, Madam Chair, thank you for the time. I really appreciate it. Can you just re-emphasize what I've re-emphasized time and time again about the 340B program, talking about the rural areas of Nevada, these health centers that have 340B programs? What would happen if those 340B programs the carpet was pulled out from underneath these institutions? What would happen in the rural areas?
Again, for the record, Adam Porth, I think that it's not a stretch. When you look at what kind of money that we're talking about here for these rural facilities, that they would have to cut back services. And so, when I think of one that's close to our area, would be Carson Valley Medical Center down in Gardnerville. Currently, they provide infusion services. They provide chemotherapy to the patients down there in the Carson Valley. I don't think that's a service they would be able to provide if they didn't have access to the 340B program. So I think that that's a very common thing. And it's not just the rural hospitals, it's the community health centers and the federally qualified health centers that we have in our state. There's a lot of services that those clinics are able to provide based on the money that they get from the 340B program. So I think you would see a huge impact to access to care in our state. And we're already starting to see some of this, these systems that are more reliant upon contract pharmacies than maybe we are, because we do have, a few retail pharmacies internally that we can rely upon. Again, as we heard in public comment, in the rural community, if you don't have your own pharmacy and you can't use a contract pharmacy, you don't have benefit anymore. So yeah, it's a big deal.
Thank you for your presentation, and thank you, Madam Chair, for the time.
Thank you. And my questions won't be as verbose. So we talk about illegal, for lack of a better term, distribution or application. And perhaps someone is not eligible. Are we talking about ineligibility because they make too much money? Or are we talking, what are we talking about when we say that? Because I think it's important for us to, my take on it is that people need, whenever they need medicine, it's usually to save their lives. And we started the whole conversation about prescription pricing because there are people who could not afford the insulin or could not afford high blood pressure medications or could not afford other things. And had they been able to afford it and get it, would now be on like a pacemaker or be on kidney dialysis. And so I'm just trying to make sure that we're clear. It's not people that, are just using it, frivolously.
Thank you for the question, Chair Spearman. For the record again, Adam Porth. When we talk about ineligible patients, it can be one of two things. One is that they had no relationship with us, so that the contract pharmacy is going to try and fill a prescription for a regular retail customer that comes in with 340B medication, and they had no relationship with Renown Regional Medical Center. So that would be one scenario. The other that we see is that because Medicaid is specifically carved out in the contract pharmacy realm, and the reason that they do that is so that it's very clean for the manufacturers to say, we are going to pursue a rebate on something that comes out of Walgreens, but we're not for a prescription that comes out of Renown. And so those Medicaid prescriptions are just simply off the table in a retail pharmacy, contract pharmacy scenario. So if by chance 340B medication does get used for a Medicaid patient in that scenario, that would be another ineligible patient that we would consider. So those would be the two.
Okay. Thank you very much. Members, additional questions, comments? Okay, thank you for the presentation. And members, the presentation we just heard is not connected to an item in our work session. However, I would entertain a motion from the committee to act on the presentation's recommendations. As presented, the recommendation is to request legislation to prohibit contract pharmacy restriction in Nevada and to establish a penalty for imposing restrictions to covered entities in the state. Is the committee inclined to support this recommendation or amend it prior to the vote? Do I hear a motion?
So moved.
I have a motion from Vice Chair. Do I have a second?
Second.
Second from Senator Lang. Any discussion? Yes, Senator O'Neill.
Chair, I appreciate your motion and I really appreciate the discussion. I need to go into further depth to look at what we're actually proposing and discussing before I feel I can give a legitimate vote on this and be in favor of it.
Okay.
So for asking for the time, I guess I will have to be a no today, strictly on that technicality. So,
okay.
Thank you.
Thank you. Senator Stone?
Thank you, Madam Chair. I concur with my colleague up north. You know, I like negotiating with these drug companies to try to get particular drugs on the 340B program. And I'm not saying that this is not something I couldn't support in the future, but I think it's too early to use a hammer. I think we should negotiate in good faith with these drug companies and make sure that there are no gaps, so we have people that, like you said, truly get the medication that they richly deserve. But I would have to see a BDR before I could put my yes vote behind something like this. For right now, I would have to vote no. Thank you.
Okay, thank you. Someone Kasama?
Yeah, I need to get a little further understanding too, so I'll vote with my colleagues on passing on this for now until I get a further understanding. Thank you.
Okay. Thank you. Any further discussion? Okay. So all those in favor of the proposed recommendation, aye. Opposed, nay.
Nay.
The nays are nays of Senator Stone, Assemblyman Kasama, and Assemblyman O'Neill. And the motion carries. Thank you. So next we will go now to agenda item number 8, overview of legislative health notes to inform policymakers about how proposed legislation may impact health and equity. Mr. Melgarejo, begin when you are ready.
Thank you, Chair Spearman. For the record, I am Cesar Melgarejo, Principal Policy Analyst with the Research Division of the Legislative Counsel Bureau and your committee policy analyst. I would like to note that as nonpartisan staff of the Legislative Counsel Bureau, we can neither advocate nor oppose for any of the topics discussed today and in this presentation. I will provide a broad overview of the legislative health notes and how certain states have implemented these types of notes. I would note that in researching this topic, it appeared that a variety of states have actually implemented racial impact statements, which is a version of health notes. But by definition, health notes are nonpartisan policy briefs that analyze how legislative measures could impact key social determinants of health, such as education, environment, employment, housing, food security, and healthcare access. Whereas racial impact statements, these are defined as assessments of the potential impact that legislation could have on historically disadvantaged racial populations. The purpose of health notes and racial impact statements are to inform you as policymakers by highlighting potential health outcomes or disparity outcomes of proposed measures, ensuring that health considerations are integrated into the decision-making process. I would note that 9 states have implemented mechanisms for the preparation and consideration of racial impact statements. There's been just a few that I've found that specifically enacted the health notes. The importance of health notes is health notes do not make recommendations. They do not advocate for or against the proposed legislation. Again, they're nonpartisan statements. Think of them as you will as the fiscal notes. They do advocate for a holistic approach for policymaking, recognizing that health is influenced by a wide range of factors beyond just healthcare. And they really are for a preventative approach. Health notes can help to proactively address the root causes of health issues, emphasizing the impacts of legislative measures on vulnerable populations. The Larson Institute of Health Impact and Equity from the School of Public Health at the University of Nevada, Reno, they used to be involved with a grant to promote this topic. However, they are no longer associated with this program. They do, however, still have a free online training on health impact notes. It's a 20-minute training, which is where much of the information for this presentation originated. This training is available at makinghealthhappen.org. It just requires a registration, but it is free. Within this training, it outlines a 6-step process for health notes. And this is the implementation process of providing these health notes for specific legislation. The first step is screening, so identifying the bills that would be most beneficial. Of not every state that has enacted these types of health notes or statements, they don't require this information for every single piece of legislation. They're either selected by specific criteria or they're requested by the legislatures or the governor. Second step is scoping, considering the potential health effects of the bills, develop research questions about the bill's connections or pathways to health. Third step would be researching, conducting and tracking a rapid evidence review for prioritized pathways identified during scoping and bill analysis. The fourth step is drafting the note, writing the health note, and obtaining peer review from subject matter experts. And I will note that the peer review process is highlighted a lot in the research of this topic. The fifth step is dissemination, sharing the final health note with the legislatures and the public. Again, just like the fiscal notes. Monitoring and evaluation is the sixth step, which is really assessing the legislature engagement with and response of the health notes or the racial impact statements, and how are they being used, how can they be tweaked, and how can they be better improved. I've included just a couple examples of some of these health notes or racial impact statements. The first one you see is, actually both of these in this first slide are actually racial impact statements. In Connecticut, a legislature may request a racial and ethnic impact statement for legislation. Statements focus on whether legislation would increase or decrease the pretrial or sentence population of correctional facilities in the state. So any legislation that impacts the Department of Corrections would require a racial and ethnic impact statement. So Connecticut chose to focus theirs specifically on this one topic. In Illinois, any legislature can request the preparation of a racial impact note for any bill that could have a disparate impact on racial and ethnic minorities. If a bill concerns arrests, convictions, or law enforcement statement is required, the Illinois Criminal Justice Information Authority is required to produce this statement. Now, the requirements as to who produces these statements in the state of Illinois is codified in statute. If a bill concerns corrections, sentencing, or imprisonment, a statement is prepared by the Department of Corrections. If a bill concerns local government, a statement is prepared by their Department of Commerce and Economic Opportunity. If a bill concerns education, this is split between the Illinois Community College Board, which prepares bills that affect the community college. The Illinois Board of Education prepares notes for bills that affect the state universities. And the Illinois State Board of Education, they prepare notes for bills that affect primary and secondary education. Any other state agency that's impacted or responsible for implementing all or part of a bill is required to prepare a statement for that racial and ethnic impact of the bill as it relates to that agency. So, for example, if there's a piece of legislation that affects natural resources within the state of Illinois, then their version of Department of Natural Resources and Conservation would be responsible for providing that racial impact statement. In Maryland, they started a pilot program in 2021 within their nonpartisan Department of Legislative Services. This wasn't a specific piece of legislation that enacted this pilot program. However, it was implemented within their budgeting process. The state of Maryland, within the Department of Legislative Services, they now have a racial equity impact unit to evaluate the racial impact of selected criminal justice measures. Factors that determine whether a racial equity impact note is published for a bill or group of bills includes whether there is sufficient data available to provide an objective analysis of the bill's provisions, if the topics addressed in the bill include current issues of concern for minority residents in the state, and whether providing information surrounding key decision points in the criminal justice system will inform legislatures and the public of possible policy implications of a piece of legislation. In the state of Washington, this is a health impact, they call it a health impact review, but the governor and the legislatures are authorized to request a health impact review for any proposed legislation or budgetary change from the State Board of Health. And so their statute requires the State Board of Health to produce these impact reviews, and the board works collaboratively with the Governor's Interagency Council on Health Disparities to produce these reviews. I wasn't able to find specific examples from the first two states. However, Maryland and Washington, they do have examples of their statements or reviews in their websites. So I provided those links to you here. So it appears that there were several stakeholders involved in implementing health notes here in Nevada a couple of years back. A lot of the stakeholders, like I said, have moved on to different topics. Unfortunately, we weren't able to find a subject matter expert that could present more on this information. However, we did have access to some of the stakeholder meeting notes. And so these next two slides provide a list of items for your consideration in implementing health notes in the state. These items are not exhaustive. They're not prioritized. There's just items that you may wish to consider if you do want to implement such notes within this state. Number one, legislative scope and criteria. Will it apply only to bills with obvious health implications, i.e. any bill that comes through the Health and Human Services committees? Or do you want these statements to be applied to broader policies such as housing, transportation, or education? A clear scope ensures that health note process is focused and manageable preventing unnecessary delays in the legislative process. Number two, integration into the legislative process. Will they be required at the committee stage, during the bill drafting, or before final voting? Early integration would allow legislators to consider health impacts before decisions are finalized, but it also requires adjustments in legislative timelines and procedures. Number three, resource allocation. Adequate resources are critical to producing high-quality, timely health notes without overwhelming the current legislative process. Number four, expertise and capacity. Health notes require specialized knowledge in public health, social determinants of health, and policy analysis. Building or assessing these expertise is essential for producing accurate and reliable assessments. Consider training for legislatures and staff on how to utilize health notes in the policymaking process. Number five, equity and social justice. Prioritizing equity helps legislatures understand and mitigate potential disparities that could arise from policy decisions. Number six, health notes. Number six is time and efficiency. Health notes must be produced quickly enough to inform decision-making without delaying the legislative process. Streamlining the process through standardized templates, clear guidelines, and efficient workflows helps maintain legislative momentum. Again, think fiscal notes and the process that we currently have with those. Number seven is transparency and accountability. Transparency ensures that public and other stakeholders can see how health considerations are being integrated in the policy decisions, enhancing trust and accountability. Again, the LCB posts all of the fiscal notes onto Nellis, where they're accessible to all the legislators and the public. And then number eight, monitoring and evaluation. Again, just goes back to the training. Regular evaluation allows for adjustments and improvements, ensuring that health notes remain relevant and effective over time. And Chair Spearman, my understanding in researching this topic is that the idea of health notes derives from Health in All Policies initiative and the Health Impact Project from Pew Charitable Trust. They've also have worked with Health in All Policies Research Center from the Institute of Health and Social Policy of Bloomberg School and Public Health, John Hopkins. So these are some of the resources that provide a lot of legislation, a lot of examples on how to promote health note policies to legislatures. And with that, I'd be happy to try to answer some of your questions.
Committee questions? Assemblyman O'Neill?
Thank you, Chair. I'm not sure you're going to be able to answer this, but what were some of the additional costs the program added to the various states that enacted health notes?
Assemblyman O'Neill, for the record, Cesar Maguire, Community Policy Analyst. No, you're right. I'm not able to answer those questions. I think I could provide you that information based on the Maryland's example and how they funded that pilot program, but most of the legislation I saw wasn't tied specifically to specific legislation.
If I may, Chair, because from your presentation, what I understand, they actually had to go out and increase their staffing levels, and there's various costs to that. And it's health notes itself an actual application that is brought in, or is it just done by staffing with the stated goal in mind?
Assemblyman O'Neill, for the record, Cesar Maguire, Committee Policy Analyst. It's health notes. They're just produced by staff, by specialized staff. I remember a specific highlight from some of the notes when this topic was discussed with previous stakeholders is the emphasis on experts from the public health education with public health masters. But with Maryland, whether they had to bring in new staff or shift new staff, they created a unit within itself so that is a specialized unit that produces these health notes. But there's no specific application I think if this was something that the legislature wanted to enact, there would probably be a lot of guidance to whatever have you, whatever, Health and Human Services or LCB staff to kind of come up with an outline of specific questions to analyze. Again, think about the fiscal notes. There's specific information that the agencies have to provide. There's specific analysis that has to be made, and so these health notes, and again, to be efficient, we have to come up with a standardized process on how to absorb a lot of that information, and it would require a lot of assistance from reaching out to, just like NOMI presented earlier this morning. They have a lot of data, and then so there would be a lot of collaboration with the agencies to provide these notes.
What I hear, and maybe you can help me understand the difference of what you're describing, these health notes, from what our research division does now at the request of any legislature and agencies, because I've asked for some of these exact points that you just brought forward, and our research division has been able to attain the information for me. I don't think it's fair to ask you, and so but what's going through my mind is I'm trying to determine what is the difference between what we can currently do with the staff that we have and the legislators and in testimony, bill presentations versus what these couple other states have enacted. So it's not a question.
No.
I don't think it's fair to make.
Well, yeah, and I'm going to jump in as a legislator who, these are the points, the salient points that I consider when looking at legislation anyway, automatically. Because we have a diverse population, I think it's important for us to understand how whatever legislation we propose, how it will impact people, whether it's people in low wealth communities, whether it's women of childbearing age, and we've got legislation that specifically looks at women who are in childbearing age or women who are not in childbearing age. We've got, when we looked at the statutes related to people who were sexually assaulted, and before 2019, there was a statute of limitations, and the legislation that we presented eliminated that, and we looked at women who would be particularly impacted by that and who had been impacted by that. And so these are what I would consider, for me, I can't speak for anyone else, but for me, these are questions I would automatically ask myself and ask my staff as I prepare legislation. What is the impact? And one of the reasons why I wanted to, Mr. Melgarejo, to bring this forward is because whatever you don't face, you can't fix. And I think there are a lot of disparities in our healthcare delivery system that cost us money. And I'll go back to prescription drugs as one thing. If people can't afford their prescriptions, and I have a family member right now who is on dialysis because they couldn't afford medication. People who can't afford the medication for heart ailments or to control cholesterol. And when we're not thinking about these things, and for people who have a bank account that supports whatever they need, then most of the time they don't think about it. But for people living not a hobby, these are some of the questions that they ask. And the other thing that I looked at, because Senate Bill 341 was a direct result of my aggravation with what we were not doing during COVID with respect to our minority and low wealth communities, putting a lot of the mental health programs at the county level. And that's not a place where these communities that needed it the most, where they would go, because they've not had a lot of good success with systems, if you will, that generally tend to discount their needs. So these are what Mr. Melgarejo has presented. This is just automatic, but for everybody, it's not. And I think as a state, if we're going to be prudent, just like we have to do with the fiscal analysis, there are different questions that are asked in the fiscal analysis that some of us would not consider. But the fiscal analysis division, what they do is they ask questions that we don't usually ask. And then they give us a determination about what this will cost. And my next question, whenever I hear that, is, so this is what it will cost, but what is the lost opportunity cost? And what will it cost if we don't do it? So for me, the health notes are a way for us to make sure that we are focusing on communities that have been marginalized, that have been left out, left behind. And most of the time, it does not occur to people because they don't have the same issues. As I said before, people who are low wealth, who are living in poverty. And for them, the price of milk could be the difference between buying 1 carton, a gallon, or half a gallon, because you have other expenses to pay. So that's what the health notes are. And so I'm not answering for Mr. Megorejo. I'm just answering as a legislator who has used this. And I think that it would be prudent for us so that we can lift our healthcare delivery system to the level that it needs to be, because we are not a monolithic state anymore. We are more diverse now than we were even 10 years ago. And if we look at the projections by demographers, in about another 7 or 8 years, we're going to be even more diverse. And so if we're not asking these questions now, that means that we have a healthcare delivery system that is not only not accessible, but it's not applicable to the communities that will need the services. Does that make sense? Yeah. So, yeah. Mm-hmm.
Sorry, I don't mean to laugh. It was just the last part.
That's right.
I do hear you, Chair, and
I'm not thin-skinned.
I hear you, and I hear what you're saying. I just feel that it's a duplication of services right now. Many bills in our term, and I've worked with you on others, we've hammered a lot of this out when you talk about minority situations, the underserved, and brought those forward. Maybe it's because it's a novel idea to me, that it just needs more conversation. But I do appreciate, and I hear what you're saying, I truly do. It's just difficult to hammer it out right now and for me. So
it's okay. It's fair.
I really appreciate it, and thank you, Chair.
I understand. Are there additional questions or comments? Okay. Thank you, Mr. Megorejo. So what we've just heard is not a part of our work session document. However, I would like to entertain a motion from the committee to act on the presentation's recommendations. And this is an actionable item, and therefore I would entertain a motion from the committee to act on the recommendation. Specifically, the recommendation of the work session document is to request legislation to require health notes for legislative measures, explaining how measures could affect issues that strongly influence health and wellness, including education, environment, employment, food security, healthcare access, and housing. Is the committee inclined to support this recommendation, or should it be amended prior to the vote? I'll entertain a motion at this time.
So moved.
I have a motion from the Vice Chair. Do I have a second?
Second.
Second from Senator Lang. Additional discussion? Yes.
Just to, as we've already discussed, I think it's a duplication and at least worthy for some more conversation. But for right now, to move that forward in that manner, I don't see the need for it. I'll be respectfully submitted to you, Chair. Thank you.
Thank you. And I guess my question would be a duplication of what that we already have in place?
The work that I regularly ask for, and you also, from our staff, particularly Research Division of the Legislative Council Bureau, and have gotten this exact information from them when I requested it. So to me, and even in the presentation, there was an inability to discuss the expansion of needed service of personnel, what the cost would be, timelines. He even said that some of the information under the consideration for the legislature, he wasn't able to go into full detail or because of the limited information available on it. So as I said, as a bill, as you're recommending right now, I will be a no. Respectfully submit it to you, Chair.
Yeah, thank you, and I appreciate that. One of the things that I am aware of during some of the workshops doing NCSL, National Conference of State Legislators, there has been a lot of discussion and talks about this. And if we use the example of Maryland, at the time that the legislation was passed in 2021, Governor Hogan, who was a Republican, worked with them and they passed it, and they passed it with the majority of Democrats in the legislature. So Maryland's was I know it was bipartisan, and I have several friends that are there. And so it may appear to be a duplication because we ask these questions, but we have 63 people who are looking at either presenting legislation or voting on legislation. And for them, this may never occur. So that's all it is. It's just let's look at this in a more standardized way. But I appreciate your hesitancy. Okay, thank you. Any others? Saruman Kasama.
Thank you, Chair. I'm certainly open to all of this information, which I think is important. I'm concerned with us moving it forward as a proposal for a bill. I would like to see a study so that we could answer all these other questions as far as cost and who's going to do it, and will it only be for health, or, just there's so many unknowns that I would be in favor of supporting a study, but going directly to a bill proposal is difficult for me. Thank you.
Senator Stone?
Madam Chair, I'll just simply say ditto to my colleagues. I'll be not supporting it at this time, again, not understanding the scope or the cost. And, I don't know if these health notes in these particular states that identify certain populations having been afflicted with certain diseases are inferring that it's because of their race or creed or whatever, that's why they have these diseases. If it's instigated lawsuits because they're not getting the care that they allege they're not getting because of racial disparities. And so I'm not saying that this is not worthy of discussion, but I think a study would be more appropriate at this time. And for that reason, I can't support it at this time, but thank you for bringing it forward.
And I appreciate that. And let me just add another element to our discussion. In 2021, in 2020, and during the special session, after much research and discussion, I carried a bill that did pass and declared racism as a healthcare crisis. In 2021, Senate Bill 297, which was a bill to create community gardens and urban farms. And we looked at the fact that it's not necessarily that people who are of African descent or of Latin descent be strictly because of their ethnicity, but it's things like food deserts that are in the places where they live. When we look at healthcare from the standpoint of asthma, many of the low wealth and marginalized communities live very, very close to the interstate. Many of the schools that children from these communities go to are in communities that have been neglected. When we think about our rural communities, there are rural communities that don't have proper access to healthcare because they don't have the roads in them that are necessary. So it's not a matter, to answer your, I don't know if it was a question, Senator Stone, or an assertion, but it is not necessarily because of their ethnicity. It is because of the location where they are, and the location where they are most of the time is due to economics. And economics, we know in many cases, even though it shouldn't be, but in many cases, people who are certain ethnicities, certain linguistic ethnicities are relegated to certain places. And which is why I said that racism is a healthcare crisis, because from that flows a lot of the inequities that we have within our community. And health notes And I appreciate everyone's opinion. I'm just stating this because I need everyone to understand why I asked for this. But racism is an overarching problem in our society, and it is one that we heretofore have really refused to look at. And whatever you don't face, I don't think you can fix. But I think that a study at some point may be appropriate. I'm of the opinion that we probably have, and if we look at the dashboard that Ms. Dortch gave us, if we look at that and look at the information that's already available, we could probably even look at information from the School of Public Health at UNR and find out that these are the things that we as legislators should be considering because they're already prevalent in our community. So with that, let me stop talking. And we have a motion made by the Vice Chair and a second by Senator Lang. We've had a discussion. All those in favor, aye. Aye. Opposed, nay.
Nay.
And nay is Assemblywoman Kasama, Assemblyman O'Neill, and Senator Stone. The motion passes. Thank you. Okay, now we will move to agenda item number 9. Is that where I am? Begin the work session, and members, you should have the work session documents, and it is also posted on the community's meeting page. The committee's meeting page. The purpose of the work session is for the committee to decide which legislative measures, if any, it will request for 2025 session of the legislature. And staff has assisted in preparing a work session document to help guide us through the work session. And the document contains a combination of recommendations based upon testimony heard by this committee throughout the interim and recommendations from stakeholders and committee members. The recommendations outlined in the document are not necessarily set in stone. If the committee is so inclined, recommendations may be amended prior to the vote. Staff will guide us through the document, and there will be a discussion period for each item the committee will consider individually. Then if members are so inclined, I will accept a motion to approve that item. Mr. Mevalejo, will you walk us through the document?
Thank you, Chair Spearman. For the record, Cesar Melgarejo, Principal Policy Analyst and Research with the Research Division and of the Legislative Council Bureau and Community Policy Analyst. As stated before, as nonpartisan staff, I can neither advocate for nor against a measure that comes before this committee. I will provide a short overview of the work session document. While the work session document is designed to assist the committee in determining what actions it wishes to take, each item in this document may be subject to further discussion, refinement, or action. As a reminder, committee can request up to 10 bills or resolutions. They can send letters or put a position statement in its final report. There is no limitation in the number of letters or position statements that the committee may adopt. The committee can recommend drafting either bills or resolutions. As you were. With that, I will now walk through the committee through the first item on the work session document. This is item A, which relates to affordable and low-income housing. The recommendation before the committee is to request the drafting of a bill to require the Housing Division of the Department of Business and Industry to annually calculate and publish on its internet website the maximum cost of living increase capped at 5% based on the Consumer Price Index for all urban consumers. Landlords would be prohibited from raising rent during the first year of tenancy and limit subsequent increases to the published cost of living index. However, landlords will be able to apply for an exemption to the limitation of increasing the rent to obtain a fair and reasonable rate of return for their property under certain circumstances. This would be a redraft of Senate Bill 426 from the 2023 session in its first reprint, which did not come out of Senate Finance Committee. This recommendation also includes to amend subsection 6B of NRS 3.19.420 and section 6 of NRS 319.430 to increase from $10,000 to $100,000 the administrative fine the Housing Division may impose upon an owner who fails to provide a written notice to certain governing bodies, the division, and each tenant affected before terminating or ending an affordability restriction, and increase from $500 to $5,000 the total amount from such fine that the division may use to cover the cost of collecting such fine. And these recommendations proposed by Chair Spearman in response to various presentations concerning housing. Madam Chair, that's all the recommendations.
Thank you. Are there any questions or comments from the committee? Councilwoman Kasama?
I would have to not move forward with supporting this. There's so many studies that show that rent control doesn't work, and unless you can control and put CPI, on labor costs and material costs and property taxes and all the other areas, there's just so many studies that show you, you will not attract developers to building more housing, and that is really what we need is greater supply. And so I'll have to vote no.
Councilwoman O'Neill?
The simple one.
No, I said.
You're going to push me down to the end of the diocese, I think, Chair, by the end of the day. I'm just going to say ditto for some other reasons. It's a bill that's just a rewrite that didn't even make it out of Senate Finance. So it has problems. We're just resubmitting what didn't pass last time, predominantly. And then for the other reasons that I'll be ditto on with my colleague, Assemblywoman Kasama. So thank you, Chair.
Additional comments? Is that Senator Stone?
Yes, thank you, Madam Chair. I feel like it's deja vu all over again. I remember debating with you and others on this bill. I'm a strong proponent of getting more affordable low-income housing in Nevada. And the way we do it is we get some of the BLM land allocated so that we can provide incentives in particularly redevelopment agency areas and build more housing. There's a shortage of housing in Nevada. And to put the onus of providing affordable housing on the private sector investors is going to stifle investment in Nevada. And you're basically going to create slums in existing housing because you're going to have landlords that are just not going to do what I do, and that is to rehabilitate and bring housing that's a little bit older to modern day standards so that people can have true habitable living conditions. If you look at cities that have enacted rent control, and this is an extreme rent control proposal, they have failed. Just look at the city of Santa Monica. Look at other cities throughout the country. If you want to stifle investment, you want to stop investors of multifamily development in Nevada, because you're going to place the responsibilities on the backs of them and have to go through another agency in the state of Nevada to get an increase, and a larger increase if you do capital improvements. You're going to be letting your apartment or your condo or your townhome or your house sit vacant for 6 months by the time government gets around to give you an approval or a disapproval. So while I do respect you, Madam Chair, and trying to provide affordable housing in Nevada, we have to respect property rights. We have to respect the average investor, which owns about maybe 2.2 units throughout the country. And to saddle them, and a lot of senior citizens that depend on that income to pay their bills, and we're going to cap them and not allow them to make investments to increase their rents to market levels, I think would be a disservice to lower income people in the state of Nevada. For those reasons, like I articulated once before, I can't support this.
Thank you. And let me just address Suleiman O'Neill. It wasn't that it was a bad bill that it didn't make it out of finance. You said that it didn't make it out of finance, so it must not have been a good deal, but that wasn't, that wasn't the reason. But here's what I will do. I will amend it to include, and this is something that we found out after, a few months after the legislative session, that there sometimes landlords feign poverty, but if you own 10 or 20 different properties, that's probably not a small landlord. So I will recommend an amendment to this and say that those who own property, 4 properties, 5 properties or less would be exempted from this. But I want to address the fact that this is something that hurts small landlords, because I'll use North Las Vegas as an example. there are more than 30% of, close to 40% of the housing rental property in North Las Vegas that are owned by corporate landlords. That's not a mom and pop situation, corporate landlords. And we talk about stifling in investment. I don't think that, especially with the amendment, I don't think that we stifle the investment, but what we do is we make sure that we don't have the type of situation that was very pervasive during and immediately after COVID, with people, with landlords doubling the rent. There had been no improvements made on the property. There's no painting. They haven't, taken rugs off and put LPV down. Nothing had happened other than there was an opportunity for them to increase the rates, and they did. And had several of my constituents coming to me, and even one who had just gotten out of the hospital and was an amputee and had 30 days, had a notice tacked on to the door, 30 days to either come up with the additional monies. The rent had been doubled. Also talking to Senator Stone mentioned senior citizens. There was a senior citizen who had $1,600 income in Social Security, and the landlord went up to $1,200 on the rent. And so there are real examples from real people for whom people who have properties and for no other reason than they could. And I even had landlord tell me, I said, why did you raise the rent? Well, because I could. And you have people who are struggling. So I'll add that as an amendment, and I guess I need to take.
There's no motion yet.
No motion, okay. So I'll add that as an amendment to the recommendation. But for those who think that we're doing this on the backs of mom and pops who only own one or two properties, we found out much later that many of the landlords who were complaining own 15, 20 different properties. And like I said before, in the population that I represent in North Las Vegas, it's more than 30%. I think it's something close to 40% of the rental property is owned by corporate landlords. Nothing against corporate landlords, but I think we all should not have anything against people who are working every day trying to make a living, and some of them working 1.5, maybe 2 jobs just to pay the rent. So I'll add that as an amendment, that it would exempt those who have 5 properties or less from the requirement. Okay, Senator Stone?
Thank you, Madam Chair. And again, I appreciate your passion for what you're trying to do. Again, if we want to provide affordable housing, we need to get the BLM to release land, and let's start building more product. There's a shortage, which has caused an increase in rent. Madam Chair, I have worked hard all my life being a pharmacist, full-time, owning 6 pharmacies, being an elected official for over 30 years, and I have managed to save and invest. And I'm one of those guys that owns over 20 pieces of property that I've worked my entire life to do. And I take very good care of my tenants. Yes, there are some landlords out there that are greedy. You've heard me say I'm a compassionate landlord. But just because you own 20 or more units and you're not a corporate landlord doesn't mean that you're greedy. And you still have your property rights. I believe we should protect those property rights. And if somebody doesn't like the rent that I'm charging, then you know what? There should be competition. They should go someplace else. If I don't replace the carpet with vinyl flooring and update their toilets and update their air conditioning units, then they should go find someplace else to live. I have virtually no turnover because I am a good landlord, and I'm proud of that fact. But I worry that what you're considering here today is going to stifle investment from non-corporate landlords as well as corporate landlords that are going to provide the necessary infrastructure so that we can provide affordable housing for people here in Nevada. Again, I appreciate your efforts, but I can't support the motion.
Thank you. Thank you. And so I've offered an amendment to the bill, and now we'll entertain a motion on the recommendation.
So moved.
I have a recommendation. I have a motion probably from the vice chair. Do I hear a second? Second. I have a second from Senator Lang. Second from Senator Lang. Any further discussion? All those in favor, aye. Aye. All opposed, nay.
Nay.
Nay, Assemblywoman Kasama, Senator Stone, and Assemblyman O'Neill. And the ayes have it, and the motion passes. Mr. Melgarejo, please continue.
Thank you, Chair Spearman. The next recommendation, still under the affordable and low income housing section, is the next recommendation is to send a letter to Nevada's federal delegation recommending and expressing support for federal legislation to address the 15-year escape hatch, which is authorized under the federal low income housing tax credit program, which authorizes an owner of a LIHTC property to leave the program at the end of the qualified contract period, ending rent and income use restrictions. Many jurisdictions, including the state of Nevada, require LIHTC applicants to waive this 15-year opportunity to leave the program, but it remains within federal statutes. And Madam Chair, that's the recommendation.
Thank you. Are there any questions or comments on the recommendation? And I think it was maybe the first or second meeting that we looked at LIHTC, and there were really no checks and balances in concrete. And so someone could apply for LIHTC, get the tax incentive, and then not follow through completely. And so what this is designed to do is it's not written in federal law, but I just felt like it was important for us to make sure that taxpayers' money, because that's what we're talking about when we talk about LIHTC, that taxpayer money, we're prudent with that. And if you get something that is gives you tax preference, I think that you should follow through on it and not try to figure out what if any loophole you can use to escape. So that's why we use the escape hatch. Are there any questions, comments? Okay, I'll entertain a motion.
So moved.
I have a motion from Vice Chair. I have a second. Second from Assemblywoman Torres. Additional discussion? Assemblyman O'Neill.
Chair, I appreciate the intent. I remember the discussion on this back in a couple sessions ago, it seemed. I was opposed to it then as being a little onerous. I'll be in opposition. Whoops, I'm sorry. I'll be in opposition again today, be a no. Thank you.
Thank you. Additional comments, discussion? Okay, and we're ready for the vote. All those in favor, aye. Opposed, no.
No.
Okay, and we have Assemblyman O'Neill and Senator Stone in opposition. And the ayes have it. It passes. Mr. Melgarejo.
Thank you, Chair Spearman. For the record, Cesar Magro, Committee Policy Analyst. Next recommendation is under the landlord duties and responsibilities topic. And this refers to landlord's duties, which is to request the drafting. This recommendation is to request the drafting of a bill to require the Housing Division to establish a statewide registry of certain landlords that consist of, the registry would consist of the name of the landlord, the state and county in which the landlord is domiciled, the total number of dwelling units owned by the landlord in the state, and the address of each dwelling unit, the amount of periodic rent charged by the landlord for each dwelling unit in the state, and the frequency with which the periodic rent is charged to the tenant, and certain information relating to property manager of the premises if applicable. This would be a redraft of Assembly Bill 332 from the 2021 legislative session, which is sponsored by Assemblywoman Peters, with the proposed amendments from Assemblywoman Peters, which is included as attachment B at the end of this work session document. In addition to those amendments proposed in the attachment B, revisions to the amendment would include limiting the requirements to landlord to rent 5 or more dwellings, require the division to establish a mechanism for tenants to file a complaint concerning a landlord, require the division to post such complaints on its internet website, and impose an annual registration fee, which the division may use to address administrative costs associated with implementing these provisions. This recommendation also includes to amend Chapter 118A of NRS to expand landlord and tenant responsibilities when a rental dwelling becomes uninhabitable due to a condition that materially interferes with the tenant's life, health, or safety, to include but not limited to requiring landlord to provide a comparable dwelling unit or a hotel room for up to 60 days or until condition is remedied, require a tenant to continue rent payments during temporary relocation, and if condition cannot be remedied within 60 days, authorize tenant to terminate rental agreement and require the full security deposit to be returned. This recommendation is based on Colorado Revised Statutes 38-12-503, which outlines the warranty of habitability for residential premises in Colorado. And this recommendation is proposed by Chair Spearman in response to the various recommendations regarding housing and landlord and tenant responsibilities. That's the recommendation, Chair Spearman.
Thank you. Questions, comments? Assemblywoman Kasama?
I'm on a roll. Thank you. I didn't support this legislation last time, and I do have concern with it. We already have in our Nevada Revised Statutes regulations regarding habitability. If there are issues, tenants can already file with the real estate division. So we already have mechanisms in place for units that are not habitable. Requiring landlords, it's an extra burden to start doing registration and fees to that, because ultimately those fees would most likely be passed on to the tenant. And we're trying to keep costs low. And this just adds to the cost of housing again. So I am opposed to this.
Just comments?
Ditto.
Surprise, surprise. Okay, there was and it just fell off my screen. There was a fire in Las Vegas, and I want to believe that it was in July of this year. It was a direct result of the landlord not paying attention to what the tenants kept saying was wrong. And I remember watching as a lady was crying. They had no place to go, still required to pay rent, and the property basically was uninhabitable, and I don't know that they ever got it to that place. And so the whole purpose of this, and I always say, we make laws not for the people who will do the right thing because it's the right thing to do, but there's some folks who won't do the right thing unless there is something in place, unless there's a guardrail in place. And so this is really designed to protect, again, those who do not have money in their bank account to pay the rent and try to figure out where they're going to stay. And oh, by the way, they still have this pesky little thing called a lease that the landlord in this property, if I'm not mistaken, was holding the tenants to. And so this really is designed, and we always say, well, they're just going to pass it on to the tenants. They don't have to. We're not saying they have to do that in this law. It would really be one of those commandments of do unto others. And so they could be guided by their heart and say, I'm going to do the right thing because it's the right thing to do. And they don't have to pass it on. But I'm really concerned about those people who are in places where the landlord does not do what he or she should be doing. And then it puts the tenants out. The landlord has a house to go to and it's safe. But the tenants who've been paying rent have no place to go. And coincidentally, the lady was talking in the camera and she had a cat. Anyway, any additional questions or any additional comments? And I'm talking too much. So, okay. Senator Stone, how verbose will you be, sir?
Not too verbose, Madam Chair. I'm just going to, number one, say ditto with Assemblywoman Kasama. Not only are you going to be paying the fees, but you're going to have to be paying an analyst for yourself if you own a bunch of properties to provide the reports that are going to be due. There'll be fines, there'll be litigation. It will be passed on to renters. What I would strongly recommend instead is that I think the Department of Real Estate does a very good job of responding to complaints if somebody is living in an inhabitable place where the air conditioning is not working when it's 116 degrees. Believe me, they're going to respond. So you're right. Some people that have limited financial means may not know what their rights or abilities are. What would I think be better would it be to fund an educational campaign that says if you're living in inhospitable conditions, that you should call the Department of Real Estate and send somebody out to make sure that the landlord's held accountable for not fulfilling their needs to provide habitable space. But this is nothing more than a vilification of landlord law that I think is going to stifle investment. And the ones that decide to stay with their investments here in Nevada are going to just pass those costs on to the consumer, which is going to even make rents even more expensive. And with that, Madam Chair, I'm going to vote no. Thank you.
And so we're ready for the vote. Assemblyman O'Neill.
Thank you, Chair. I don't have a question or comment. I just want to make a comment. Chair, I appreciate your discussion or your statement you made about a fire down here in Las Vegas. I've got to tell you, I feel for people that are living in substandard or questionable housing, as you just described. For years, I have spent my life in support and in protection of those individuals. And when I retired, I have worked with the Salvation Army, where we have responded to just those incidences. And even as this past summer with the Red Cross, going out to people that have had their apartments burned and provided housing, clothing, all the needs, including backpacks so their kids can get, their children, I should say, I apologize, their children will be ready for school. So this is not it's a serious subject, and I do feel for them. And I'll just add in, and it's the rest of the reasoning as already been described. I have the heart, we all have the heart, and we have ways to address this without providing additional legislation. And it's just a statement that I wanted to make. Thank you, Chair.
Thank you. And so we're ready for the vote now. Assemblywoman Kasama.
I will try and be really quick. I just wanted to acknowledge we don't want anybody living in uninhabitable conditions, but we already do have in regulation that if it's uninhabitable, a tenant can reduce their rent for the issue. The tenant can actually break the lease for the issue. These complaints can be filed. Department of Health can be notified. So we already have these mechanisms in place that should be robustly used, because any landlord that continues to maintain uninhabitable conditions, like the example you gave, should absolutely be held accountable to the full extent of the law. Thank you.
Thank you. And so with that, I will entertain a motion.
So moved.
Have a motion by Vice Chair. Do I have a second? Second from Senator Lang. Further discussion? All those in favor, aye. Opposed, nay.
Nay.
Nay, Senator Stone, Assemblyman O'Neill, and Assemblywoman Kasama. And the ayes have it, the motion passes. Mr. Megalejo. Let's do a 120-second recess. That's 2 minutes. And it won't be a legislative 2-minute recess. It'll be a real recess, real 2-minute recess, okay? We're in recess. Be right back. Okay, we're back in session. Mr. Mayor Hill.
Thank you, Chair Spearman. The next recommendation relates to unlicensed contractors, and which is to the request the drafting of a bill to revise the statute of limitations for a violation of NRS 624.700, which prohibits a person who does not have an active contractor's license from engaging in the business of a contractor, acting in the capacity of a contractor, or submitting a bid on the job, to provide that the period for commencing a prosecution of the offense begins on the date which the offense was discovered, and if the license activity resulted in harm to a person or the property of a person, extend the period for commencing a prosecution of the offense from 2 years for the first and second offense and 3 years for the third or subsequent offense to 4 years if the victim is 60 years of age or younger, and 5 years if the victim is 60 years of age or older. And this recommendation does not include that subparagraph A. Recommendations are proposed by Chair Spearman in response to testimony and exhibits provided by the State Contractors Board. And Madam Chair, that's the recommendation.
Okay, and we just had a discussion, and I think one of the amendments we'll make is the portion that says someone's going to tell on another person. We'll take that out. I think the Contractors Board said that they didn't want to go to the 4 years, but what I'm going to ask them to do is to accommodate persons who are 60 years or older or vulnerable populations like we have in some other statutes. I want to make sure we tie that to it. And I'm thinking specifically about something that Assemblywoman Torres told us about a member of her family. Someone came and told them something about because the legislature passed something, they had to do something. And so when people do that sort of thing, there's a special place in hell for them. And I want to make sure that we have the statutes in place to incentivize people not to do those things. And if they choose to do them, they already know what the consequences are, and the consequences are very severe, if that makes sense to you. Okay. And the clarification that Davis just gave me, is that we're talking about when the homeowner discovers. Is that correct?
Thank you, Madam Chair. Sam Quas, Committee Counsel. Yes, it's my understanding that you'd like to, the recommendation is to extend the statute of limitations to begin on the date on which the homeowner discovers the violation. However, I would say that there may be circumstances under which it's never discovered by a homeowner because maybe they submit a bid on a job that doesn't involve a homeowner or something like that. So the statute of limitations in that experience where there's not a homeowner could either remain the same, that could be adjusted as well, or this specific statute of limitations in situations where the unlicensed contracting, much like what's described in the document where there is a victim, the victim is a homeowner, and the date on which the victim discovers this would start the process, which I believe is what the recommendation is.
Yeah. And so let me get Contractors Board, can you just come to, I want to make sure that, so we've already eliminated the Scrimmer recommendation, the tattletale piece, we're eliminating that. I'd like to keep in place for people who are, and I'm trying to make this consistent with the statutes that we have in place for crimes committed against persons, elderly persons. And so if it is, the victim is someone who is 60 or above, or a member of the vulnerable population, shall we say, then let's extend that statute of limitations, and because there may be some things involved that would prohibit them from getting in right away, from understanding this is what you can do right away. Does that make sense to you? So the other statute, I'm conceding that we won't change it for everybody, but I'd like to at least make it comparable to the statutes that we have in place for seniors and vulnerable people.
Thank you, Madam Chair, members of the committee. I'm Terry Wyke. I'm the Director of Investigations at the Nevada State Contractors Board. A couple points that you make are worthy of attention. The first one, I believe Council indicated that the statute of limitations would begin, the discovery rule basically would be to begin on the date of the violation. But we would have to establish what a violation is. Under our 300 section of 624, that only applies to licensed contractors. So when we're speaking of discovering a violation, that would need to be clarified. As the statute of limitations under NRS 624 section 800 currently describes it as within 2 years after the commission of the offense. And the offense in an unlawful contracting situation is the actual contract. That's the date of the offense, is when they enter into that agreement, whether it's oral or written, to do the work. So we would need to establish, as council indicates, what a violation is. In addition to that, there are senior protections under NRS 620, or I'm sorry, NAC 624-7251 subsection E, which would enhance penalties even for an unlicensed contractor. It would enhance the penalties for someone of 60 or older. And we do impose that additional penalty when seniors are involved. But I think the word violation and the word offense needs to have some type of definition if your proposal it should go forward. Thank you. Thank you.
Yeah, I'm not a judge and I'm not playing one on TV, but I understand. Yeah, I'm getting ready to. Yeah, so here's what I'm gonna do. So the concept for me, and Sam, I want you to chime in. Here's the concept. The concept is someone who is 61, shall we say, or 61, and there is a contract, and someone has put forth themselves as a licensed contractor, which they are not. And then at the time that the homeowner, who is 60 or 61, finds out, number one, that it's shoddy work, and number two, that the person has lied and is not a contractor, those enhanced penalties and the definition of victim or crime or whatever, that I'd like it to be so that whenever it is discovered, then that's when the clock starts. Does that make sense to you? Because you can say 2 years, but if it takes someone 18 months to do something, and then in the 19th month it is discovered that it's shoddy workmanship, or it's discovered that the person is not licensed, because those are the ones that we're trying to go after now, the people who are not licensed. So Sam, can you speak to that? Can you make me sound smart with and deciphering what I just said?
Thank you, Madam Chair. Sam Quas, Committee Counsel. Yes, I believe I can speak to that. First of all, as far as discovery, in 171.095, there's already provisions that say if an offense is committed in like a secret manner, it starts on the date on which it was discovered, right? And so the Nevada Supreme Court has interpreted the word discovery in that context to mean when someone knows of the act and of the unlawful nature of the act, right? So it's not that different from the date on the commission of the offense. The discovery would be when the person knows of the act that constitutes a violation, an offense, and knows of the unlawful nature of that. So in this scenario, I believe the discovery would be when the person knows that this person has acted as an unlicensed contractor and in the context of their dealings with them. So whenever they find that out. So in any case, I believe the recommendation would be for persons 61 or older, as well as vulnerable populations, when that person discovers that this person has acted as an unlicensed contractor, that's the date that it would begin.
Can you live with that?
David Behar for the record. I think that's language we can work with you on. Yes.
Okay, all right. Well, so we will, the motion that we will be taking will be based upon the language that our legal counsel just gave us in terms of clarifying when it happens or when the discovery is. So whatever he just said. Assemblyman O'Neill.
Thank you, Chair. Just for Mr. Quest, we're talking, this is all civil actions, correct?
Sam Quast, Committee Counsel. No, this is strictly criminal actions.
Criminal actions. So we're giving for a construction defect, basically more freedom to take action for criminal action than we provide for grand theft autos, burglary, because they all have statute of limitations from the time the offense occurred.
Yeah, let me jump in because I wouldn't, this is not with chapter 40. So I'm not trying to open that up at all. This is something completely different. We're talking about unlicensed. So I'm not talking about chapter 40. Okay, construction defects, I'm not talking about that.
Maybe I used the term wrong, and I apologize. We're talking about some defective work, though, being done by a person who allegedly purported him herself to be a licensed contractor. And we have given them unfettered time for the victim to claim this criminal action, which to me is, I think we're giving too much to it. I appreciate the contractors board saying they could work with some of this language. I see some, and I'm not an attorney just as you are, Chair. I don't even act like one on my days off, but or play one. But I see some legal conflict in here between other statutes, other criminal acts, and this alleged criminal act.
Well, I'll tell you what we'll do. We're going to let legal sort it out, but that's the concept for the BDR, okay?
And I appreciate that's why I guess what I'll go to is I'll be a no on
Yeah,
it.
and it's okay. It's okay. And I want to acknowledge that we have one of our members that is in a bit of a pain. And so what I'm going to try to do, I want to move through these and try to get the vote so that we don't exacerbate the situation at hand. Is that all right? Okay. So the motion would be to clarify, and if there's any ambiguity in the concept that we just talked about, then that ambiguity would be sorted out with our legal team. Yes? Okay, so with that, let me entertain a motion.
So moved.
I have a motion from Vice Chair. Do I have a second? Second from Assemblywoman Torres. Any further discussion? All those in favor, aye. Opposed, nay? So it looks like it's unanimous? No, Assemblyman O'Neill, nay. Okay, and the motion carries. Mr. Melgarejo.
Thank you, Chair Spearman. The next recommendation is regarding a certified registered nurse anesthetist and to request legislation to amend the NRS 632.2397 to delete provisions that prohibit a certified registered nurse anesthetist from ordering or prescribing a controlled substance, poison, dangerous drug, or device outside of a critical hospital. And Madam Chair, that's the recommendation.
Thank you. Any discussion, questions, comments? I'll entertain a motion.
So moved.
I have a motion by the Vice Chair. Do I have a second? Second from Senator Lang. Further discussion? Assemblyman O'Neill.
I'll make it quick. Having met with the nurse anesthetist very recently and the medical boards, I'm going to be a no on this. They still need to get together. They have to discuss it. They have told me that they really haven't had a chance to talk on this bill at all. And I don't see the need for them to be right now, as I read this, the expansion of the nurse anesthetist's ability to prescribe some of these drugs. So I will be a no.
I appreciate that. Okay. which means that they'll have incentive to talk about it before this next session. Okay? Okay, so with that, I have a motion from Vice Chair, a second from Senator Lang. All those in favor, aye. Opposed, no? And we have no Senator Stone, Senator O'Neill, and Assemblywoman Kasama. The motion passes.
Chair Spearman, for the record, Cesar Maguire, Community Policy Analyst. The next recommendation is relating to service contracts, home warranties, which is to request a drafting of a bill to codify in statute subsection 1D of Nevada Administrative Code 690C.110, which requires that a service contract include a statement that if the holder is not satisfied in the manner which the provider is handling the claim of the contract, the holder may contact the Commissioner of Insurance. The statement must include a toll-free number of Division of Insurance of P&I and be written in plain language and an appropriately sized font, and to require the Commissioner of Insurance to adopt regulations to establish a system of rating service contract providers doing business in Nevada based on compliance with the requirements in Chapter 690C of NRS and the number of consumer complaints filed with the division. Division shall post the final star rating assigned to the provider on its internet website that is accessible to the public. Madam Chair, that's all the recommendations.
Thank you. And the BDR and these recommendations are a result of last session when we heard some very chilling accounts of what home warranty companies were not doing and how they were not performing. And the language, the plain language piece, is designed so that people understand what they're signing at the time that they're signing. That 800 number gives everyone access, even if they don't have a computer. And so do I have a motion?
I'll move that,
So moved.
Senator Spearman.
Yes?
I'll move it.
Okay, we have a motion from Senator Stone. Do I have a second?
Second.
Second from Vice Chair. Further discussion? All those in favor, aye.
Aye.
Opposed, no. And the ayes have. I'm going to back up to the last, not this last one, next to the last one. And I just heard from Assemblyman O'Neill, he is a yes, not a no. Is that right?
I said yes.
Okay, he said yes, okay. Okay, on this one.
On the record, yes.
Okay,
Aye.
warranties.
Warranty.
Okay, all right, got it. Okay, so the ayes have it. Okay.
Thank you, Judge Spearman. The next recommendation relates to homeowners insurance wildfires. For the record, Cesar Maguire, Community Policy Analyst. The first recommendation is to send a letter to the governor of the state of Nevada expressing support for the Division of Insurance B&I to conduct a feasibility study for the possible creation of a fair access insurance requirements plan related to wildfire property insurance. Further, the letter shall support a governor's task force of state and local government and industry partners to study certain factors that influence the state's wildfire risks, such as building code, infrastructure mitigation, and zoning and planning statutes and regulations. And Madam Chair, that's the recommendation.
Thank you. Assemblyman O'Neill.
Chair, I've been actively involved on this one issue. I would ask if it would be possible to change in the letter where it says fair access to insurance requirements, that fair plan or other reasonable or other possibilities, recommendations, just don't limit it to the fair plan, because there have been some issues with it.
Yeah, well, and in our discussions with the Commissioner of Insurance, that's one of the reasons why the task force, because we need to make sure that it is expansive enough to cover whatever we don't know now, and make sure that they can come back with a recommendation so that the people who are living in places where their homeowners insurance is in jeopardy. So, okay.
That's why, excuse me, that's why I was asking for that expansion, because the way I read this, it's just to look at the fair, the fair plan. When I'm reading in this, send a letter to the governor.
So we can to clear up the ambiguity. Sam, were you going to say something? Okay, we can clear up the ambiguity, because in the discussion that I had with the commissioner, it was the fair plan was one of it, but they wanted to use that as a template, but look at all everything that could or would be considered. So we can just make sure that we put in there something about it's not exclusive to the fair plan. So that'll be the wording. That'll be the wording in what we're voting for right now. Okay. Additional questions? I'll entertain a motion.
So moved.
Have a motion from the vice chair. Do I have a second? Second from Senator Lang. Any further discussion? Not? All those in favor, aye. Aye. All those opposed, nay. And the ayes have it and the motion passes.
Thank you, Chair Spearman. The next recommendation, which is the final recommendation, is to request the drafting of a bill to require the state forester and fire warden to adopt regulations designating zones of high fire risk, require the governing body of a county or city to disclose to any person who wishes to construct a structure, residential or non-residential, in an area of the county or city designated as a zone of high fire risk, the fact that the structure will be located in such a zone, and require the seller of a residence located in a zone of high fire risk to disclose to the purchaser of the residence the fact that the residence is located within such a zone. And Madam Chair, that's the recommendation.
Thank you. And we did discuss this as well with the insurance commissioner, and it's based on similar legislation in Florida when people were building houses right on the beach, and even in some parts of Texas, building right on the beach. And right now, even in your homeowner's insurance, there's a question on there that says, are you located in a floodplain? So that's what we're trying to do, and to make sure that people who purchase properties know what they're purchasing, and that all of those things are disclosed, so that down the road, 5 years from now, they don't discover, oh, I didn't know that's where I was. So that's what this is designed to do. I'll entertain a motion.
So moved.
Have a motion from the vice chair. Do I have a second? Second from Senator Lang. Additional discussion? Oh, was that Assemblywoman Torres? Okay, I'm sorry, Assemblywoman Torres, second. Additional discussions? Okay, all those in favor, aye. Opposed, nay.
Aye.
And the ayes have it. Thank you. I think we have moved through it. We're now at public comment. Is there anyone in Las Vegas for public comment? Anyone in Carson City for public comment? And BPS, do we have anyone on the phones for public comment? And public comment, again, will be limited to 2 minutes.
Thank you, Chair. To provide public comment, please press *9 on your phone now to take your place in the queue.
Good afternoon. I'm Steve Messenger. That's Messinger. I'm with the Nevada Primary Care Association. I want to thank you, Chair Spearman, first for your compassionate and impactful career of service. We also want to thank the committee for your vote to advance a bill to protect contract pharmacy access in the 340B program for your constituents and to ensure the critical funds the program provides to Nevada's safety net providers. We represent the state's federally qualified health centers, which use 340B revenues to deliver services proven to lower costs for Nevada Medicaid and to provide care for more than 35,000 uninsured patients. We appreciate Dr. Porath and Renown for an excellent presentation describing the threats to the program. For our health centers, 340B revenue is estimated to be about 16% larger than their federal grant, about $27 million in 2023. While we hear this body's concerns regarding the interests of pharmaceutical manufacturers, we have to emphasize that the continued erosion of 340B dollars will need to be replaced by public funds, or we will see services reduced and eliminated for the state's most vulnerable populations in remote communities. Last session, this legislature guaranteed that insurers could not tell your constituents where they could buy their medications. This session, you have a chance to ensure that pharmaceutical manufacturers cannot prevent patients from accessing affordable drugs at the pharmacy that works best for their family. We look forward to working with you and the other stakeholders to protect this program It is critical for both patients and Nevada's safety net providers. Thank you.
Chair, there are no additional callers in the public comment queue at this time.
Thank you. We have some folks at the table here in Las Vegas.
Thank you, Chair. My name is Olivia Tanager, again for the record. I know that the motion to discuss the outdoor worker bill was pulled, but given public comment earlier, I wanted to get up here and talk to you about that legislation. So I was involved in the bill to protect people working in extreme conditions last session, and in fact wrote the provisions outlined in the legislation. And I want to talk a little bit about why I did that. Leading into the last legislative session, I met several people who worked outside who had experienced a health crisis from working in extremely bad air or extremely hot temperatures. I heard stories of people's shoes melting and burning their feet on the job, stories of people passing out, stories of people having to be hospitalized for days because they weren't getting enough oxygen while doing critical jobs for our state. Now, I support OSHA beefing up its protection for workers in extreme conditions and can't state enough how much I appreciate the information they provide to the public and the work they do to protect workers. But the reason legislation was brought last session and legislation might still be needed is because OSHA has limited enforcement resources and because the workers who have experienced these things while trying to put food on the table for their families have asked us to. They believe that legislation is needed for their employer to follow regulation, as was pointed out by our robust coalition of union representation last session. I suspect that is the same reason why people got up here today and told you that they were concerned about their profit should these regulations be put in place. So let me be clear. The legislation they were so concerned about last session was pretty straightforward. It asked that in extreme temperatures, workers be provided with water, shade, and allowed to take breaks if they want. In extreme air quality, workers would be provided with masks if they wanted, water, and allowed to take breaks. We also ask that employers train their employees working in these conditions. That's all. So I'm going to say today, and I hope I don't have to get back up here in a few months and say this again, if your business model depends on not letting your workers have water or take breaks in extreme heat, you should have a different business model. These people are my neighbors, these people are my family, and these people are my friends. If you come into an air-conditioned room and attempt to block efforts to protect people working in extreme heat so they can feed their families and keep a roof over your head, maybe you should take a little walk and think about the kind of world that you're advocating for. Those people who are working outside right now are people's parents, people's spouses, people's children, people's loved ones, and they deserve to be protected at all levels, from OSHA protection to state legislation to federal regulation. Thank you.
Good afternoon, Chair and committee members. For the record, my name is Matilda Guerrero, Government Relations Director at Native Voters Alliance Nevada. My dad is turning 70 this December. He is one of 10 kids. He started working when he was 10 years old to support his siblings after my grandfather died and kept going up until 6 years ago when his body finally gave out. He faced not one, but two emergency and exploratory surgeries fighting for his life in the ER. After that, he spent over a month in the ICU battling complications from severe internal bleeding caused by ulcers. Those ulcers didn't just appear, they were earned. Day in and day out, working as a master mechanic in his own auto repair shop in Stephanie. I almost lost my dad 6 years ago. My dad worked himself to the bone, enduring scorching heat and endless hours to put my brother and I through K-12 and higher education. He sacrificed everything so I could be sitting here today. Now he lives on a fixed income of $1,174.80. I just fact-checked that by looking at his bank. I have the login, just to put that on the record. His health insurance alone cost about $100. The mortgage for our 4-bedroom, 1,200 square foot home is $1,690 a month. While my dad is fortunate enough to not face the immediate financial crisis discussed during the work session, the reality is clear. Under these circumstances, relying on Social Security and by himself, he wouldn't be able to afford a roof over his head, let alone feed himself, pay for life-saving medications, keep his car running, or simply live with dignity. And
Just to be clear, this isn't about numbers or playing my violin for the committee. This is about someone's ability to survive. My dad has given everything for my brother and I, and now as a society, we must ensure that others like him are not left to fend for themselves in their most vulnerable years. And most importantly, thank you so much, Chair, for your service, and I'm looking forward to hopefully seeing you some more out in public. Thank you.
Thank you. Do we have anyone in Carson City? Don't see anyone. BPS, anyone on the phones?
Thank
No
you,
one on the
Madam
phones?
Chair. The public line is open and working, and there are no callers at this time.
Okay, thank you. Thank you. This is the last meeting for this committee today, and it is also my last meeting as a senator. I'll still be in office. I don't end until midnight election night, but it's the last meeting, and I think I've caused a lot of good trouble. But anyway, I want to give space for our committee members to say anything that you'd like about our interim committee or else. Someone Kasama?
Thank you, Chair. Thank you for your service. We all dedicate a lot of time, and public service is hard and most people don't realize it. And we get beat up, all of us, no matter who serve. And so thank you so much for your service in running this committee.
Chair, it has been an honor to be your vice chair. Thank you so much. You are a wealth of information and a bright light. Thank you for everything you've done for our state, and I know that you're going to do so much more. So I just want to say I have been honored to serve with you.
Thank you. Thank you. Thank you. Yes.
I wasn't sure you're going to give me the time, Chair. Chair, I think we first, actually, before I came to the legislature, back when you were in 2013, I assisted you, and actually I remember your sister, meeting her on dealing on some adoption issues, as I recall. I've got to tell you, both outside of the legislature and now as a legislator, having worked with you on several bills, veterans bills, it's really been a very enjoyable experience. On the few bills, the very few bills that we have disagreed on, it's been respectful. And it's always been discussion of policy, not personality, which I think is somewhat of a rarity in other legislative bodies, not ours. But I want to congratulate you. And speaking specifically on your work here on the interim committees, you've done an outstanding job. And thank you for allowing me to be with you. I'm sorry that you're leaving. I wish you the very best. And as we always said before in my old division and outfit, Godspeed until we meet again.
Thank you so much. I appreciate it. Okay, so, I see Senator Stone.
Thank you, Senator Spearman. I want to also congratulate you for many years of public service. I think we probably share that in common, but I have witnessed your passion, and I love your passion. We didn't agree on a whole lot of things, but looking out for vulnerable populations is something that's important for you, and you've been a champion of these populations. And I just want to say thank you. You were always very courteous with me, allowing me to come in your office and share my concerns with you. You're always responsive. I appreciate that respect, and I just want to wish you good luck in your personal life with good health. And I expect that we'll see you in another office at another time, and maybe we'll still continue our short relationship that we had together. But thank you for your service to the state of Nevada.
Thank you. I appreciate that. And so with that, I think we are done between the military and here as a senator, I've got about almost 45 years of public service. It's probably more years than some of you all are old, but I've enjoyed it. Everybody keeps asking me, what am I going to do next? And there are people trying to get me to do, and I thought I'm going to take some time and figure it out and get some rest and probably go on a couple cruises. I don't know, but At any rate, I certainly appreciate everybody. And for those of you who stayed around to the very end, thank you. For those who are up north, thank you. And thank you for everyone, because if there's any success that I've had, it's been because of collaboration, and I really appreciate that. And with that, we are adjourned.